Our informational meeting. It is Tuesday, August 21st. I'm a little out of breath, so I apologize. We'll call this meeting to order. We need a motion for approval of minutes.
So moved. Second.
All those in favor say aye.
Aye. Aye.
Motion carries. Our next item is open discussion. Anything for open discussion? Councillor Staley.
I just wanted to comment again on what we talked about last week with going around to these different neighborhoods. Councillor Starr and I went out a week ago Saturday, and then I went back out again on a Wednesday to look at these different high crime call neighborhoods, high police volume. And I want to say that one of our stops took us to Tim Stanga's home. And unfortunately, it was dark when we got there, but Tim's been very concerned about things happening in his neighborhood, and rightly so. But he took us in, and my gosh, Mr. Stanga, you should see the garden. He has tomatoes 10 feet tall. He has these cucumbers. I mean, it was just, I was so impressed, so fabulous. So we hear these people sometimes giving us input, and maybe some people don't like hearing from these people. Also, Sierra Bersaud, she came with us, and I just got a call from a woman who's in the massage therapy business, and she said Sierra was able to get some arrests happening with this because of her persistence. So what I'm saying is that we always have to be listening to these people, even if they may not come from our walk of life. We don't necessarily like their message, or they're continuously repeating their message. I think there's a lot of good that happens within their own lives, and they're trying to do something good for our community. A lot of them don't have a lot of money. They might come from the wrong side of town. They're not powerful and influential, but they care and they're trying. So I'm just really grateful to know these people, and I hope we all have a chance to get to know them better.
Any other open discussion? Councillor Kiley.
Just wanted to give kind of a shout out to the Public Works Division, Jerry Jungling in particular, a little over, 2 weeks ago with National Night Out. I stopped by my old neighborhood because they hosted a get-together right next to my own home. And one of the neighbors asked if we could do anything about streetlights. And so I said, I can certainly report your concern. And so I sent that off to Director Cotter. Director Cotter forwarded it to Jerry, and then last Tuesday after this meeting, I drove through the neighborhood, and in less than a week there was another street light put up. So thank you very much, Public Works, for your quick service to the citizens. Appreciate it.
Thank you, Councillor. Anything else? Councillor Staley.
On a different note, I want to put out a shout out to Erica Beck. A thank you. In my 2 years on the council, I've developed a kind of a rhythm as people, they send me emails, they're concerned about things, and I've been sending those through Jim David and saying, Jim, please forward these to the appropriate department. And it's been good. I've gotten lots of responsiveness that way. I think it's good to have a paper trail going. But I met with Erica Beck last Friday, and she indicated to me, she said, Teresa, we, in this new administration, we want to develop an energy where we're getting more of the complaints and working with that and making something happen. We want to change the culture of how this has been handled for customer service. And so I said, Erica, how about this? Moving forward, what I'm going to do, because anytime someone calls me, if they're able to, I say, send me an email with that concern. So that we're all on the loop. But what I'm starting to do now, and I told Erica I would do it, but I say to the person, send that to me. I did several in the last day. And then we forward that, I forward it to Jim David and Erica Beck. That way they're both working to get that to the right department. And then I always say, keep me and the citizen on the email chain. Because sometimes what has happened in the past is they've addressed that with the citizen, but I didn't know what they were saying. And then the citizen comes back to me, and I'm not sure what they were told. So it's about communication, it's about responsiveness, and I'm really excited because I think we're moving towards more of an embrace of our whole community and listening to all the people. So just wanted to put that out there. I know we all have different ways of handling those citizen concerns, but it's been working.
Thank you, Councilor. Anything else for open discussion? I will add in, I know I sent the council an email, and I want to just reiterate that if you feel as if you have departments or directors that you need to bring forward with additional questions, please be working with David Bixler on that, and we'll compile those. In the past, we've had 2 or 3 working sessions for our budget. There's been years where we've had none, and so that's okay too. But I just want to encourage you all to be thinking if you have departments that you'd like to be brought in. One of the areas I did receive feedback from one counselor that mentioned having a working session with the funding, additional funding, unobligated funding projects, if you will, and having that in a working session. And so a list will be provided from the administration, which is not limited to anything that you choose to have included for funding. So a list will be provided in the next day or so from them, and we will potentially add in a working session in the next couple of weeks before, obviously, the budget hearing. So I just want to make sure that you are all aware of that, and if you have additional departments that need to come forward, please let me know. We will move on to our budget hearings. Our first one is Director Jill Franken with Public Health. Welcome.
Welcome. Oh, thank you. Thank you for that welcome. Yes, I'm Jill Franken, I'm the Public Health Director, and I'm really pleased to represent the department today with our proposed 2019 budget. Big thanks to Amy Richardson and Tim Conda and Tom Huber for all the work that they've done, as well as the management team in the health department for helping put together this, what I think is a responsible budget for 2019. Let's see. I think I know how to do this. There we go. Yeah, we'll go back. Okay. So the total budget for the health department is $3.4 million proposed for 2019, and that makes up 3% of the total city budget and 8% of the operating budget. And that 3% might sound like a small amount, but it does pack a punch. There's a lot that we accomplish in a given year. 78% or $10.2 million is budgeted for Falls Community Health programs and services, and 22% or $2.9 million covers the resources needed for our community health, safety, and code enforcement services that we provide. Falls Community Health, as a clinic, Counselor Sale, should I hold off for a second here? It's okay. I'm okay. A little technical, that's fine.
That's okay. I'll look at his. We'll let the boss work on it.
Sure. I can wait.
Oh, hey, there's an open spot. Oh, is there a switch or something?
Did you touch something?
Sorry about that.
Amy has to deal with me once in a while, having the same difficulties. So Falls Community Health, we provide, as most of you know, primary medical, dental, behavioral health services through coordinated and integrated care delivery. In addition to providing this high quality and affordable health care through Falls Community Health, the health department also mitigates adverse health conditions and threats through a number of services, programs, et cetera, to keep our neighborhoods healthy, help make sure we're prepared in ensuring response to emergencies, and to advance healthy living, all which are responsibilities of the health department. So on the revenue side, the health department generates a significant amount of non-sales tax revenue. This equates to over $10 million of our total budget and is generated through a variety of sources, including federal, state, and local grants, patient charges, business fees, as well as license and permit fees. I just want to make a particular note of how we are able to receive revenues from our patients. They pay for those services at Falls Community Health, for those dental, medical, behavioral health services in a variety of ways. About 50% of our patients are just very typical to how you may pay for your healthcare services. They may have insurance, private insurance, because we do have a percentage of our patients who are insured through private coverage. And then we also have patients who are on Medicare. So if they're over 65 and they're eligible for Medicare, or they're somehow disabled and on some Medicare assistance, or Medicaid as well, through the adult Medicaid and children Medicaid program. So the remaining 50% are those patients who are uninsured, and that's where our federal grant kicks in. And our federal grant allows us to provide that sliding fee discount based on their income, which is set by the federal poverty guidelines. And so along that continuum, that's how we are able to determine what percentage of that total charge they are able to have taken off, and that goes to our grant. And then they are responsible for the remaining. So that's the critical access that we partner with our federal resources and our state resources and our local resources, you, the city, all of us, to be able to provide that access to care for patients at Falls Community Health. And it's a significant part of our mission and why we're here, because we want to make sure people are able to access care regardless of ability to pay. So, what resources do we need to carry out the duties of the health department? This is a breakdown of the major programs that we have in our budget. And I just want to kind of give you a little sense, because it's hard to tell based on, in the millions, exactly what kind of increase or decrease we're seeing with these various programs. So overall, Falls Community Health is increasing from year 2018 to 19 proposed by about $400,000. Community health, safety, and enforcement side is a little about $100,000 or so for 2019. So when you break that down, our vector control, our code enforcement activities, and our food program are increasing each anywhere from $24,000 to $28,000, right in that range. Health, wellness, and our EMS services and programs are increasing $8,000 to $10,000 each. Our environmental lab actually is decreasing this next year for various reasons by about $8,000. And our preparedness, our daycare program, and our licensing programs are increasing about $2,000 to $3,000 year over year, just to give you a sense of that. So looking at our budget another way is looking at it based on our personnel, our people that provide all the services. We're very people-heavy, a very service-oriented department, as you know, as well as those operating costs of supplies, materials, et cetera, that we need to do the work of providing the services to the public and our patients. Our personnel costs make up about 70% of our budget, and the increase from 2018 to 2019 is similar to what you probably heard from Human Resources Director O'Toole. That would be our cost of living increases, our steps for our staff who are advancing from maybe step 1 to step 2 along the scale. So in addition to that cost of living increase, they'll also be eligible for a merit increase year over year. And then also insurance increases. I think Director O'Toole talked a little bit about that with you. And that makes up about 2/3 of our budget increase, are those personnel expenses. And part of that is the transition of 2 patient support technicians. These are very significant staff. They're very frontline staff. They're the first point of contact, whether by phone or in person, that our patients have with this clinic. And they're responsible for the customer service, they're responsible for scheduling appointments, they're responsible for the initiation of the revenue cycle and getting all of that accurate and done in a very efficient manner, collecting money, things of that nature. And as you know, we're recommending converting some of that part-time staff to 2 FTEs. And we're very pleased about that recommendation coming forward, because we feel that will be very beneficial to the turnover issues we've had with that particular level of our workforce. We've had challenges. It's a very competitive market with the health systems in place. We are oftentimes, those part-time people are easily finding full-time jobs elsewhere. And so the more we can have those staff here longer, get them trained up, and doing their work. It's going to be better for us in a variety of ways. So other operating expense increases are also related to some behavioral health service components. I just want to take you back a little bit to a change we made for 2018, and you approved a transition as well for 2018 of having contracted behavioral health counseling staff to having actually full-time staff. So we took a similar approach with some behavioral health staff for 2018, and so we've hired 2 counselors full-time, and they are working with us, and it's working out very well. In addition to that, at the national level, there's a real push for increasing behavioral health services in community health centers. This is like the second wave of that push, actually. We've done some things prior to 2018 even. But we are going to be adding a little bit more of our psychiatric nurse practitioner to be able to serve our patients. We're also able to increase some of the medications that we can provide for medication-assisted therapy for opioid addiction, an emerging issue, and we're seeing more demand for that in our clinic. And we're one of the, I will tell you, we're one of the leading clinics, not just in our community, but in the state for providing that service to people that need that very badly. And then we're also using some of those dollars that the feds are saying we can use those for to do some community awareness around addiction issues. And so we're going to take some of that money and work with some folks, probably similar to a little bit like what we did with our STD campaign, Protect Your Parts, and do something around substance abuse awareness and have that be something we can have for both patients, creating that awareness, as well as the community at large. So we're excited to be able to do some of that work with those dollars as well. And then the remainder of our operational increases are really just related to things you might know or, that might come to your mind, supply increases. We have a little bit of increase again in interpreter costs. That's an annual increase that we see. We have some increase in some of our collections expense, but that also means that when that expense increases, we're collecting more. So our revenue then goes up as well, so that's offset by that, as well as some claims processing costs. So those are our, that's really in a nutshell. It's not a real exciting budget this year, but it certainly is one that we will be able to provide the services that we need to and fulfill what we're working on with our strategic plan and our mission and carrying out the activities that we need to as a department. So with that, I don't know. There we go. That's just a picture of most of our team, and I thought it might be nice to leave you with that. And I'm happy to take any questions that you may have.
Thank you, Director Franken. Councillor Sale.
Thank you for your presentation. I just have one question on page 52 of the budget. In 2014, you had 71 full-time positions and total number of visits at 44,037. Today, you're asking for 82 full-time employees, and the latest numbers you project are 44,538 visits. So just up a little bit, but 11 more employees. I'd like you to address that.
Sure. We have, in the last couple of years, we've done quite a bit of work, and you're going to see it reflected a little bit in what we actualize in 18 and then also in 19. There's been a dramatic shift in the last few years in what we're seeing both in the private sector with productivity and how much physicians are able to really manage in a given day, and other providers that are seeing patients on the front line, as well as in the community health center world. And so what this is really responding to that and trying to set realistic expectations for our provider teams. There's a tremendous amount of burnout out there across the country. You can't hardly not read about it in the medical journals. And so we're trying to make sure that we're aligning based on what we see across the state. With health centers, we also look at MGMA data, which is a national data repository, if you will, that gives us some information about provider productivity and those norms, and so we've just realigned over time to be able to manage that and make sure that we can retain our staff, not burn them out, and still be able to provide the services that we are. So that's what you're seeing. And some of that, as far as from 2014 to 2015, 16, some of that also was a shift. We had contracted staff that we were not reflected in some of those. If I'm remembering correctly, that would be right. We were working with Center for Family Medicine for a number of years, and we brought in those FTEs in-house. Some of you were on the council at that time and remember the work. That was pretty rigorous work to do at that time, because that's a fair number of FTEs that we brought in-house and hired our own chief medical officer as opposed to contracting out for our chief medical officer, which brings us more in compliance with the federal requirements for health centers as well. And so that's some of what you don't see in there, is the FTE that we contracted for as opposed to hired directly. So that's some of that increase as well. You bet.
Thank you. Any other questions? Councillor Staley?
Okay, well, just a few questions.
Sure.
When you're talking about, you said some people are using insurance, some have Medicare and Medicaid. Mm-hmm. Why would a person come to your facility if they have insurance versus going to like McGreevy Clinic?
Sure.
And how many people, what percentage of that, and that's 50%, we're talking about the people who are actually paying for that. What percentage so why would they come, and then what percentage do you think come who have private insurance?
Well, it averages about right around 14%, 15% of our patients, to answer your insured question first. So about 15% of our patients have private insurance. That varies a little bit year over year. We've seen just a little bit of an uptick with the Affordable Care Act, but not significantly. And then why would people come to our clinic? There's a variety of reasons. First off, it's absolutely essential that we have a payer mix that is not all uninsured. We couldn't even keep our doors open if we were just taking patients who were uninsured. And so it's a absolute business model that when we apply for that federal funding, that we are looking at a balanced payer mix. So that kind of answers your question. We actually want people to be coming to us. And so that's part. And then to answer your question, why would they? There's a variety of reasons for that as well. And that part of that is they may have started out uninsured with us, and then they were able to become covered in some way, and they like their provider. We provide really great care at Falls Community Health, and we have, we have quality measures to back that up as far as how we are providing that service and what we do. And so a lot of people might just stay with us. Another is because of the cadre of services that we provide. We have quite integrated care in the clinic, and that involves nursing case managers that will be there every week if you're in the hospital, and weekly they go and they're doing care conferencing with the providers and making sure there's transitions of care home that are really important to make sure that care coordination happens. We have case managers that work with the provider team for those patients that are more complex. We provide medication-assisted therapy, and many of those patients are insured. They're not all uninsured, and so we're an access point for that kind of care. A lot of patients like going to the same place where they can get their primary care and then also see their behavioral health counselor at this, in the same clinic, rather than having to go to another clinic for those services. And quite frankly, they just really, a lot of them, we get great patient satisfaction reports when we do those on an annual basis as far as how much they like the providers and the staff. And so I think a lot of that is just those various reasons. Do you do any marketing to the private sector that, I guess I haven't been aware of that, but where you try to attract people who have their own insurance? We have tried, within reason. Some of this is based on demand or capacity that we have. A lot of times we don't have a lot of capacity for new patients, and so it's sort of a balancing act. But where we have done marketing is around our school-based sites in those neighborhoods. So in the Hayward neighborhood, in the Hawthorne area, and Terry Redland, we have worked, and especially out in Hayward, we've worked really hard, especially with the Hayward Thrive group, to really try and promote our clinic and work within those schools as well to really promote the services that we provide. So we're really getting those kids and those families in for those, at those clinics.
Okay, just a few more here.
Sure.
So do you offer any kind of pharmacy service?
Yes, we do. Yep, that's also part of, and that when I talked about the medication-assisted therapy, it would actually be the medications that we would be able to provide. But yes, we do. We work with the 340B program, which is the federal pricing program for medications, and so we get the lowest price that's out there for medications, and we're able to transition that cost, lower cost to our patients. And
So can they go to any pharmacy they want then?
No, we work with Lewis. We have to have a contract for that, and so we contract with Lewis Eastgate for those services.
Okay, Eastgate. All
And then
right.
we also have, it's called prescription assistance, so some pharmaceutical companies will provide free medications for people who qualify, and so we have folks that can help get them enrolled in those programs as well. So those are just a couple of examples.
What's the minimum someone pays on that? So it's the worst, well, not worst case, but if someone comes in, no ability to pay, what's the minimum that you charge?
It's $15 for a medical visit and $35 for a dental visit.
Okay, and then of the federal grant, do you have the amount that we're getting from them?
We just applied for federal funding renewal yesterday. We just submitted it. It's $2.7 million total for that federal funding.
Cool. Okay, and then what's the cost of living increase going to be?
Well, the cost of living, that's the COLA that Bill would have talked to you about. So
That you're still negotiating, or?
Well, that's, yes, for 2019, I don't have.
Yeah,
that
but what you were going to say too?
Well, I was thinking about now, not the future for 2019. Sorry, I don't know 2019's yet. That hasn't been negotiated, I don't believe. I'm not aware of, I'm not privy to
So when you
those.
negotiate, you're in with which group do you negotiate with?
We're just the general AFSCME group. Yep.
Do you know, when is that going to be?
You know, I don't have any involvement in those.
It's coming soon, isn't it? Well, I thought those contracts, don't we know when those contracts are coming up?
I know there's a schedule and there's a plan, but I'm not aware of where they're at in that schedule and that plan. I'm just not.
Thank you, Jill.
Sure.
Counselor Selberg.
Thank you, Madam Chair. Thank you, Director Franken. Good-looking crew you have there.
I know, isn't it?
Yes, very nice. Two quick questions. One is, did you say one of the full-time positions that was added was strictly focused on opioid addiction?
Well, we're going to increase some of our psychiatric nurse practitioner that we have right now, but we're also going to provide more medication-assisted therapy. So we'll be able, we do have one of our providers who's ready to, it's called, they have to apply to be able to do that work and get that approval that they can provide medication-assisted therapy. And so that's sort of through I think it's the Board of Medicine, but I'm not positive. It's at the federal level that they have to apply for this and get waived to do this work, it's called. But then we can buy more of those medications for patients who are otherwise unable to afford them at the rates that they otherwise would have to pay for them. So that's what we're going to be able to do, is buy more of those through our 340B pricing, I think is how we're going to.
So we have some of that going on now, but we'll be able to do more.
We'll be able to do more. Mm-hmm.
And there's certain people that or is there a position that is dealing with just opioid addiction?
Yes.
Because I would imagine that's skyrocketing annually.
It is, and Dr. Tingley, our Chief Medical Officer, is doing a significant amount of that work. She's actually quite an expert in it. And then also we have, it's now a requirement of the residency program for all the residents to be trained to do this work, which is awesome, because now we're going to be graduating all these residents into primary care to be able to do this work. So on the public health hat side of me, not in the clinical necessarily, I'm really excited to see, because many of those residents stay local and they hopefully will be more engaged in providing that service down the road. So that's another great one. But yeah, we have a significant amount of that being done in this.
Good,
Yeah.
good. One other question, just curious, on the first page, under 3,300 health inspections, what exactly falls under the term of nuisance cases?
Sure. Our nuisance cases would include primarily residential issues where we get complaints, and most of those are complaints that are called in, but some of them are just from as our inspectors are driving around town, and if they see something, they're going to stop and they're going to investigate. But those are mostly issues with neighborhood homes, or maybe it's an apartment or something that's related to trash, not maintaining your trash properly. It might be because you have things outside that are not meant to be outside, sitting in your lawn. It might be an accumulation of branches that now are becoming a great harborage for rodents, etc. We also deal with some work in the interior of a home if the structure is such that it's creating a nuisance, like vermin can come in and out of that home, and it's in a condition that is not good for the neighborhood. It might be spreading disease or has the potential to spread disease. Those would be some examples of nuisance cases.
I figured there'd be quite a variety in there, but it's just curious. So.
I think recently you were shared the assessments, and I think Luann was here last Tuesday, and some of those very cases that we end up having to do cleanups on would be within that number.
Right. Interesting. Thank you.
Mm-hmm. Thank you. Councilor Starr?
Yes, thank you, Director Franken. So just because I'm the nerdy one, I think, of the group by the time we're done. So number-wise, yeah, exactly.
Yeah, I know. I'm
No,
going through the numbers pages here.
I won't go there, but too much. On page 47 and then of the budget book, one of the things that shows a pretty significant increase is in the drop in the amount of fines, contributions, and interests. And I guess I was just looking for why we're forecasting that much of a drop, or if there's something that
I
stands
printed
out.
off a copy, and so are you talking about the 156,000 to 119?
Yes.
You know, that's just based on, I'm not real positive, but I can get you information on that, but that would just be that'd be our code enforcement work. And so based on, we budgeted for 156 this year, but how we're trending in this year tells us then how we need to budget for the next year. So it's all based on where we're at with those things. And we also had some, if I'm remembering correctly, we had some contributions through, that's kind of a catch-all bucket, and we had some, I think, contributions. Any given year, we have partnerships with Live Well Sioux Falls that, we are doing some kind of a program or a project or initiative, and I think we had a couple of changes that we forecasted. It might be a little less in 2019.
Makes sense. It was looking from 17 to 18, there was about the same amount of an increase and then dropping back down.
Sure.
So, I mean, that makes sense.
If any of that isn't correct that I just told you, I will let you know. So, but I'm pretty sure that's what it is, so.
Perfect. The other is that I was looking at when you look at the sources of revenue that are coming in, the general fund contribution is increasing by about 20% overall from the city's funding. So roughly 200,000 is coming from federal and state grants. And so, I mean, that's it's unfortunate, but fortunate that we're able to fund your department. And I'm sure there's other places where you could show us where we're not doing as much as we could and some of those things. But one of the things that stood out to me was also the amount of capital funds that are going. It's a significant increase. So it's some things that we're catching up. So would you visit with us just a little bit about where we're catching up? It looks like an X-ray equipment that we're replacing and some other things.
Yeah, these are those types of items that are rather expensive but have a longer life, and so you're not going to see them real regularly in the capital plan. And so one is, the hematology analyzer. It's just, it's lived its life, and it's costing us more to your repairs and the service contracts than it is to actually replace it, and it needs to be replaced. And then the other larger item is X-ray imaging system and medical. It's also lived its life and needs to be replaced as well. So those are the two higher ticket items. We have a dental sensor also for one of our school-based sites. It helps with our dental x-rays that we provide. So those are, and then there's a dental unit. Every dental space an operatory has a unit, and every so many decades or years, we have to replace that, so.
So is this part of our X-ray system? Does this take us digital or to the
We are
next
already
step?
digital. We've been digital for a long time. So, yeah, when we moved into our new space, we went digital, so we are able to do all that. Yep.
So, the other place on page 49 that kind of stood out was the expenditures for overtime. Mm-hmm. Is there something different this year, or are we?
No, I don't think so. You know, you can see 2016 actual to 2017 actual. You know, we're always trying to keep our overtime budget low. It's pretty minimal when you look at per total personnel costs. I don't have a really good answer for that. I didn't get really, we monitor our overtime very closely, and luckily we're able to keep it pretty low compared to maybe, you know, some of your other departments that have to have people on call and a lot of overtime hours. But that's just, you know, based on where we're trending and where we actually ended up in 2017, trying to keep it in line. So there's a little increase there. Yeah.
Sure,
I'm kind of guessing 2018 might come in a little higher than 12,700. So.
Well, that's why I was looking at that number was, you know, you're just getting back to what 2017 actual was, or
Yep.
with a small increase. So I'm sure it was noise complaints downtown.
Well, more and more.
Sorry.
Well, actually, more and more, as our providers just are trying to be busier, not trying to be, they are busier. They end up working over their lunch hour oftentimes, or even into their lunch hour a little bit, or maybe past 5 o'clock, finishing up seeing a patient rather than saying, no, we got to end it right here. And so that's some of where, and we're just seeing more of that. And try as we might, 2017 ended up coming in a little higher than we might have anticipated and how we budgeted for 2018. So we're trying to right that for 2019. So.
No, it makes sense. Just trying to decide if this is the right time for this, but maybe it is. And I probably need some help from finance because it's a little deeper than what we're doing. So
okay, we'll try here.
When we budget in the capital program for a pickup or a couple of pickups or sedans, I thought those costs went to fleet first, and then they just charge you on an annualized basis for what that vehicle costs, rather than, so then the replacement value's there later.
I believe that's correct, but I think the purchase that's in the budget for 2019 has to occur, and then it will go into the revolving fund.
So these we're adding to the fleet program as...
Well, they're not, one of them I believe is actually considered new. I may have to have someone come up here and answer that, Tom.
Is this an okay
Thank
time?
you.
Do you want to do it now, or do you want me to? Please.
Welcome.
Tom Huber with the Finance Office. Jill has it right that we are starting to, as we buy some of those, trying to get them into the revolving fund, but there's also a transition. Can't land everything in fleet just right off the bat and start grabbing those costs out of the operating side. So it's a transition. So health's still in a transition. So some of these will still remain in here until we can complete that transition to having most all of those equipment in being taken care of out of fleet. They are still being maintained by fleet, and fleet's watching the vehicles, so.
Totally makes sense. Thank you.
Thank you, Councilor Kiley.
Thank you. Jill, I really don't have any questions, but I would, it was my pleasure to serve as a board member on the Falls Community Health.
Yes.
And with the Health Board as well for a short period of time. And during that time, my eyes were really open as to the services that are provided to the citizens of Sioux Falls. And I would encourage any of my colleagues that have not had the opportunity to tour Falls Community Health Clinic downtown or any of the satellite clinics to do so, because you will truly be impressed. And I would put the service that Falls Community Health provides, I would compare that to the services that any of our health providers in the city of Sioux Falls provide. So a job well done.
Thank you.
And I know that the challenge is ever increasing. It appears that you've had nearly 2,200 additional visits, health-related visits to the clinics this past year. And I can only assume, tracking now that we're into August, we're well past the halfway part, that maybe we're tracking ahead. of the previous year?
If that's a
Can
question.
you address that?
Yeah.
It is a question.
You know, I think and I'm going to just qualify that. We have, for our providers that are working here, we are trending in a very positive direction. One area that we are struggling with is hiring a fourth dentist. Dentists are really hard to come by, and if you recall, at the end of last year, we had a funding threat at the federal level where we just kind of held off for a while on some of our positions that were vacant. And once that funding threat in February was no longer there, we then were aggressively trying to hire again, and we just haven't been able to land on a fourth dentist. And so that's what we're continuing to be recruiting for. So there could be a little bit of that reflected in and we had one of our staff, a brand new advanced practice provider, bless her heart, she had a injury, and so when she was first starting, she was off for a few weeks, recovering from an injury, and so that'll be kind of reflected in that as well. But I'll tell you what, they are working very hard, those, and doing very well. I think our dentists actually, when we monitor every month our productivity, and they were well over 100% of what we expected from them in their productivity for year to date. It was really pretty impressive, and our other providers are doing very well also. So,
could you just remind the council and the public, in addition to the clinic downtown, where the other satellite clinics are operated?
Sure. Our very first clinic was at Hawthorne Elementary a few years ago, and then we expanded to Terry Redland Elementary, and then our third and most recent clinic was Hayward Elementary.
And all located in areas of need as well?
Absolutely.
Do you foresee any expansion at any of those satellite clinics, or maybe the need of establishing one at some point in the future elsewhere?
I see us serving more patients at those clinics and fully continuing to keep growing within those clinics as far as how many people are served, especially the kids. We just want to get really good at doing that work. We expanded, actually, I think, pretty quickly to 3 school-based sites, and so we just want to really, the people that work there love doing that work, and so we want to just get really good at that and then maybe think about that down the road.
Very good. Okay, thank you, and a good, again, good job to you and to your staff.
Thank you.
Thank you. Any other questions? Councilor Staley?
Just to follow up, how much does it cost when you told me about medical, dental, behavioral health visit minimum on that?
That would be $15.
15. And then one more thing, the Lewis, I didn't realize that we had a contract with Lewis Drug. So Eastgate. So when that happened, how long have we had that relationship with them?
Oh gosh, Councilor Staley, I'd have to get back to you on that, but it's been at least 10 years. So
was that put out for a bid?
No, we weren't required to do that. So
at what? I'm just thinking if other pharmacies, and I did just put that on Facebook, we have a relationship with them. I would think that'd be something that might be appealing to a lot of different places. Is there a reason why we gave that just to the Lewis?
Well, we only had so many dollars to be able to purchase medications, and so it would take a infusion of revenue or money from the city to be able to then provide more, because you have to have a certain formulary of drugs to make it advantageous for people to have the variety that they need to be able to go to that pharmacy. So we'd need to increase that, because we own that stock of drugs at that pharmacy. It's a virtual stock, and we own that. And
but they're making, I would think, some kind of a profit on it too.
Just the dispensing fee.
The Lewis, right. Mm-hmm. But again, I just would think that if other pharmacies know that there's that relationship, they might, just like banking or anything. And I'm not sure in our government how we decide who gets to do business with us, but yeah. Does that ever, somebody made a decision at some point to go with Lewis?
Well, the decision was made based on research that we did to look at where our patients go for their pharmaceuticals, and by and large, the vast majority went to Lewis Eastgate, and so that's how we decided that should be the pharmacy we absolutely go with, because the majority, prior to us even doing this work, the majority of our patients were using Lewis Eastgate.
Okay, thank you.
Yeah, and you have to be a patient to be able to qualify for our 340B program. You have to be an active patient of Falls Community Health. So.
Thank you. Any other questions? Seeing none, we'll move on to our next one. Thank you, Director.
Thank you.
Appreciate your presentation. Next up is Planning and Development Services, Director Mike Cooper. Welcome.
Good afternoon, council members. Mike Cooper, Director of Planning and Development Services. Also, since we're wrapping this up today with our final 3 presentations, again, thanks to the finance and our management teams for helping put all this information together. And I'll just lead off by saying we do have 3 budget presentations today. All of these fall under the umbrella of Planning and Development Services. The affordable housing is a separate budget just because of the uniqueness of it in terms of the revenue and programs. And of course, transit, we've always separated that out as well because we're using a third-party vendor to manage our transit system. So I'll start out with the Planning and Development Services overview. And just as a reminder, back in July, I did a quick informational to the council about who we are. And the premise of that was to give you kind of a heads up of the organizational changes that Mayor Tenhaken implemented with the merger of what was community development with what was planning and building services, and just explaining how that relationship was put together and going forward between those 2 entities. So I don't expect to cover all that again today, but just focus more on the numbers as far as what we're proposing for the 2019 budget. But we do like to use this slide because it does help tell the story of what we do, what value we present to the community. Much like police and fire, we save lives through education, prevention, inspection. We help grow the city through planning, economic development partnerships, and we protect property through ordinances, inspections, and enforcement. So this is a graphic way of continuing to tell our story to the community. So our 2019 budget proposed by program, and again, we're in a little bit of a unique situation because we're presenting this based on our reorganization, our merger, and so some of this might be a little bit unique to the budgets that we presented in previous years. The planning budget remains flat at $2 million. The building services is up by $200,000. We're also increasing our community outreach neighborhood program by $100,000, and I'll talk a little bit more about what that means going forward. These other parts of what is now part of our budget were brought into us from the old community development budget, and these are pass-through funds. So the CVB for promoting branding and marketing is $3.5 million projected revenue. The economic development continues with the support of the USD Discovery District, Ford Sioux Falls, and the Development Foundation. The downtown development includes support for downtown Sioux Falls operating budget. There's a pass-through money from the Main Street bid, which is an assessment against downtown property. And then the Hilton Garden Inn is a unique bid that when that project came forward, there was a special tax put on the hotel rooms of $2 a night that goes back to help fund that project. So that continues going into 2019 as well. And then the other TIF funds that we have with our active TIF districts, TIF projects, that we have 12 of those. That will vary from year to year, but as those revenues come in through those increased property taxes, then we pay out those funds based on the agreements that we have with each of those projects. So let's just really emphasize that a TIF is not a grant. It's a pass-through of increased property taxes that are paid because of increased valuation as a result of new construction. So the total increase is $200,000 from 18 to 19 for the requested budget by program. By category, when we absorb the economic development portion of community development, We continued on with a neighborhood services coordinator position and an urban planner position. And then we also are repurposing one of those positions into a new mechanical inspector position. Currently, we have a chief mechanical inspector and 2 mechanical inspectors. And again, if some of you remember earlier when we were getting our different inspection teams to present to you what they do, Mark Polly, our chief plumbing inspector, was asked, well, what other needs do you have? And he said, I think we need another mechanical inspector. And so we like to repeat that story because it just tells you the team effort and the team approach that our folks have. So we're very pleased to put this into the proposed budget, and we're actually getting close to filling that position for the balance of this year, but that will have a budget impact going forward into 2019. And then our other operating budget increases would be the USD Discovery District, as well as our neighborhood outreach in terms of programs. So it's a net increase of 300,000 from 11.4 to 11.7. Just specifically for our planning section of $2 million, continuing with some of the metrics and some of the goals that we have as far as customer service. We want to continue on with our current responsive planning for a well-developed city. As you know, a lot of your tasks involve projects, plans, requests that come to you from Planning Commission hearings. And in fact, we're looking forward to a number of those tonight, aren't we? So that will continue on. But we try to meet this goal of, from the time something comes to us, we have that 40-day window from submission of a development plan to a Planning Commission hearing. We also want to enhance our customer service capabilities with our customer service. And this is a picture that we've added of our new customer service counter at City Center. I think it's been going very well, by the way, because we have not only planning and development services team behind the counter, but we have Parks and Recreation, we have engineering, and we have alcohol licensing, along with fire inspection. So we have a number of city services, which is the whole idea of having that one-stop shop at City Center. And I think it's, as I said, it's been going very well. We enhanced the customer capabilities with responsive and efficient services, such as 2 days from request of non-residential inspections to the actual inspection, and then 2 days from residential application submittal until a building permit is actually issued. Another area that we've been working on hard is with our InterGov system and our online permitting and inspection process. And I'm happy to report that we can put this together in more detailed metrics for you. But as we started tracking at the beginning of this year, our online activity, it has significantly gone up throughout the year. So as an example, back in January, we had a total of 261 transactions with our online service, our online capabilities. And by July now, it's over 550. So we're getting more traction, more use of our online capabilities for the variety of permits and plan reviews and inspection requests. And so that's a very good trend that we're pleased to see go forward. And then I would also say that as we talk about our building services request of $4.1 million, last year we did over 6,750 permits and completed just over 56,300 inspections, and we've got them all broken down. This is kind of a repeat of some of the things that I went through with you back in July. And I know one of the questions that always comes up when we look at budgets and staffing is how do we project from year to year what the expectation is going to be for building construction? Because it does ebb and flow, and we've gone through some record years of building permit activity. Right now, from last week's statistics, we finally reached 500 million of building permits year to date. So at the end of last week, we were at $504 million of building permits. And so we fully expect that with the rest of the year remaining, that we're going to end up with another extremely strong year for building permit activity. So those inspections, those plan reviews, all the different activities that building services is involved with continue to go forward at a pretty robust pace. This is a summary of report that Matt Tobias presented to you earlier, the 2017 Code Enforcement Annual Report. And just again, a summary of the level of activity that we experienced last year. This is part of what we're now branding neighborhood services, which is what I told you about in July with that report and that presentation. And a lot of focus on compliance through different types of enforcement activity. But this summary, as we said before, the number of cases that we see grows, but we're still doing a great job of volunteer compliance. That 90% roughly that Matt keeps telling you about, and the neighborhood services team that involves other city departments, that's still pretty good. And I was really glad when the assessments team came to you for approval, the unpaid assessments. The fact that nobody showed up to appeal those says that I think we're doing a really good job of really focusing on those real cases that are a nuisance or a violation, but also trying to work with property owners to get those citations, those costs paid for, so that they don't have to come to you as unpaid bills, so to speak. So what is neighborhood outreach? We're asking that to go up about $100,000 for the 2019 budget. This is a continuation of programs that started under community development and also under our neighborhood services division, of really trying to be more proactive as we work with either a neighborhood association, it might be a specific rental property. So what can we do to be more proactive in terms of reaching out with neighborhood assistance, neighborhood support, neighborhood resources to help with whatever situations might be going on? And one thing that we're still working on is we're working on getting a neighborhood meeting up with the Norton Acres folks to address some of their questions and concerns about enforcement, about city requirements and city ordinances. So we can take this forward to a large neighborhood, we can take it down to a small property owner or rental property. And the fact that you went out, a lot of you went out with the neighborhood night out, you saw a lot of our team at some of those events, some of those activities. And again, it's not just neighborhood services, it's police, fire, it's health, it's all the different teams that help with what we're calling neighborhood outreach. So we would like to expand that and enhance that a little bit for going forward in 2019. Our economic and downtown partners is a continuation of the community development budget, and these are primarily pass-through funds. As I mentioned earlier, the CVB, which is the lodging and occupational bid tax of $3.5 million. The USD Discovery District would go up by $500,000 to support that enterprise and that initiative. The Forward Sioux Falls funding, the downtown Sioux Falls with the Main Street bid, our donation contribution to Sioux Falls Development Foundation, and then that $2 room tax for the Hilton Garden Inn. So that's up by $500,000, which is the Discovery District increase partnership going forward. Our capital budget is pretty simple. We have sculpture walk of $20,000, and then we have our facade revitalization in our core areas of $80,000. So that is also something that, as we look into 19 and beyond, what can we do to enhance that facade revitalization program? What can we do to make it more broad? Whereas in the past, it was pretty much a downtown facade easement. What can we do to enhance that, of looking at some of these other neighborhoods, some of these other storefronts, and some of these other properties that could benefit from this type of a program? So that's why we want to move that forward at an $80,000 level of money. And we think that we can come back and really show you how that is going to enhance development within core areas, as well as continuing to make it applicable to some of the downtown properties as they go forward with some redevelopment ideas. So, and then of course, Sculpture Walk has been a great program for many, many years, and that will continue forward with the purchase of the People's Choice Award. So that's a real quick overview of the proposed portion of the budget called Planning and Development Services.
Thank you, Director. Any questions from the council? Councillor Staley.
Let's go back to this neighborhood outreach. You're wanting 200,000?
We want to increase it by 100,000, yes, from what was last year.
Okay.
As part of the community development budget, so yeah.
So, yeah, I'm needing to know what the specifics are. What are we getting for that money?
Yeah, the specifics would be something that you'd like to see, like a list of things that we would be doing.
Right, well, because, I mean, if you're talking about having our neighborhood watch police officer come out, I wouldn't think that would be an added expense, right? Having Adam Roach come out. I mean, when I've been involved with these neighborhoods, we've had some of these things going on in different areas. That's city staff coming out, so I wouldn't think there'd be any extra expense in that.
Well, this is really kind of direct support to the neighborhoods. Neighborhoods themselves is one of the main focuses of what this would be.
You mean you're going to give this money to the neighborhoods, like grants?
That would be part of it, yes.
How big of a part of it?
Well, maybe I'll have Adam come up and he can maybe help you.
Okay.
Because he's been working with this.
Okay.
As we started it under a different name.
Well, and I know we used to talk about associations, and then that we had books made up, and but that kind of drifted away, and I was told that we're kind of coming back to that neighborhood watch thing, which is really, I don't think is costing the city
So I'll have
a
Adam
whole lot
Roach
of
kind
money.
of help address
Okay.
your question. Thank you.
Welcome, Adam.
Adam Roach, Neighborhood Services Coordinator. So essentially that would reinstate our grant funding, which went from $25,000 to $8,000 last year. So it reinstates some of that funding, and we'd like to increase that. We have over 24 neighborhood associations now that are all competing for these funds. Our max cap last year was $5,000 per neighborhood association. So we do have a lot of creative and neat projects out there that really build community and help neighbors out. So we'd like to increase that, and then also assist different identified needs that we do see when we're out in the community. Say it's, a good example is a person just needs a dumpster to clean up their property. They don't have the resources to do that. Do we have the ability to, or the support to provide that to them and to clean up that property? Because we know that citing them will not help them out. So just taking a creative approach. And then also we're looking at a neighborhood notification network as well, where individuals would be able to put their phone number in there, a buffer around their property or the property that they're interested in, and receive different notification updates on whether it's a rezone, it's a raise, street sweeping, things of that nature. So really enhancing communication with the customers.
So would it be fair to say that 100% of this money, this 200,000, is like a pass-through fund? It's going directly to help the citizens?
I'm not sure where you got the 200,000.
Or you said it's up from 100,000 to what? What was?
200. It's all
It's, you want to increase it 100,000. So, I mean, I'm very involved with this. I've been talking to these associations. I'm not sure they're aware that they have $5,000 that they can have. I was talking with the All Saints neighborhood. They got some money, and it was kind of a one-time thing to do. They did some project. But if we're giving you an extra 100,000, I mean, to me, I know it's not millions of dollars, but I really want to know what that I'd like to see you show us that 100% of all this money is going directly to help these citizens.
Well, I know for sure that our grant program was earmarked to receive that increase.
Well, and that none of it's going for operational costs, i.e. paying people to come to these neighborhood meetings. You know, whether it's the police force, to me, if we're having you come in, even if it's on a weekend, that's part of what we're hiring you to do.
That's part of my salary.
Yes,
Yep.
and just like I go there, and a lot of us are going and giving many hours, extra hours to help these people.
Yep.
So I would like a breakdown of what we're getting for that
Yep.
money, please.
We can certainly provide that.
Okay, and then one more thing for Mr. Cooper. If you could give us an example of what some zoning violations would be.
Sure, it could be, the most common types of zoning violations have to do with parking, illegal parking on property, parking on the grass, parking in the wrong place. Zoning violations can pertain to signage, they can pertain to fencing, they can pertain to buildings, but a lot of those that we deal with are on the property themselves, around the property. Parking of RVs illegally, those kind of things we spend a lot of time on in terms of the zoning enforcement.
So they're a lot of times they're kind of a transitional thing. They're not like somebody would, or could it be somebody had a fence there for 10 years and then the city says that fence is not zoned correctly, it's too high or something, or?
Yeah, if a fence gets put in without the proper permits or improperly, then that would be a violation. But I would just say that the majority of the cases that we see for zoning violations each year have to do with something around the property. Parking, RV parking, trailer parking, a lot of those cases we deal with every year.
Zoning, okay, thank you.
Mm-hmm.
Any other questions from the council? Councilor Starr?
Thank you, Madam Chair. Director, there's a couple of things. First of all, I'm totally excited about this neighborhood outreach program and the increase in funding. I've also worked with Councilor Staley on a number of neighborhood associations, and sometimes it's just a matter of taking care of paper goods and plates and cups, or the creativity that our citizens put together. And I always encourage these groups to include the police department and the fire department, because there's nothing like a fire truck to draw a crowd, or to have the police unit, whether it was part of neighborhood night out. And the one I was at, people came running when they saw the fire truck pulling in, trying to figure out what was going on, or to try to, and the smoke that was coming from a couple of the hamburgers that were being fried as part of that. So I'm encouraged by this, that we're trying to engage our citizens and involve them in getting to know their neighbors. And for a very small amount in the big picture of our budget, it's an awesome thing to do. One of the places that I was looking, though, as we go through the budget process and reorganizing economic development and moving it back to planning and putting it there, was there a number that was put together that this was just because it made more sense? Was there a cost savings overall that came as part of this restructuring? Or how do we explain to citizens that, you know, by combining these departments, we were able to save X or Y?
When the mayor decided to go forward with this initiative, I think the focus from his perspective, and now I'm speaking for him, so wow, it was
I
not,
do it all the time too,
yes,
so go ahead.
It was not focused on budget per se, but it was focused more on who should be responsible for economic development. And so it should be Ford Sioux Falls, it should be the Development Foundation, it should be the Chamber, as opposed to under the previous administration, it was more the city economic development team. So that was the main focus, is to change that direction back to the Development Foundation and the Chamber. But at the same time, there were, such as Dustin Powers moved over to Planning and Development Services. Dustin is our downtown person, and Adam Roach is our Neighborhood Services Coordinator. And then one of the positions that was under economic development, as I've said, has been classified as a mechanical inspector. So the focus was really on who should take the lead on economic development. And that lead would now be the Development Foundation and the Chamber. We still provide resources, we still will provide assistance. And it would be, I think it would be interesting to hear how often each week we get requests from the Development Foundation about information on a site or utility costs, those kind of things. So we still have a strong role as far as assisting with that, but we're just not the lead like we have been in the past, which is kind of a long-winded answer to your question, but
No,
that's,
actually, it was a really good
that's the focus,
question of
yeah.
where the focus is and how it's there, and eliminating a director position frees up a good chunk of change by the time we're done too. So combining those services in that way. So thank you.
Yes, you're welcome.
Councillor Kiley.
Thank you, Madam Chair. I just have a question regarding code enforcement cases. Maybe Matt is the person to answer, but I noticed that the inspections completed outnumber the total cases. So what generates an inspection without it becoming a case?
Probably a follow-up inspection.
What's...
Introduce yourself.
At Tobias, Neighborhood Services Manager. In Planning and Development Services, what a case would be is a lot of times we would have an invalid. We would not, it would be an invalid complaint where we actually would send someone out to do an inspection, but then it wouldn't generate a case. So it would actually be something that we would go out to, or if it was a case that was corrected and we didn't have to actually start a case on that.
Okay, for instance, in nuisance vegetation, there are cases with violations, 1,802.
Yep.
Cases invalid, 244, so total cases, 2,046.
Oh, so we do have an cases invalid there.
Yes.
Where it would be a total case is it would be like a reinspection, anything that would stem off that other case I'll just call it a reinspection at that point in time.
Makes a lot of sense.
Yep.
So some cases require multiple inspections.
Exactly. Yep.
And then I did notice under property maintenance that we had 204 in compliance after notice and 202 cases with violations. So we must have convinced 2 property owners to comply without even being noticed.
We sure did.
Good job. Now that's proactive work.
You bet.
Okay, that's it. Thank you.
Thank you. You bet.
Good job.
Councillor Neitzer.
Yeah, I just have something I want to share with you about the core facade program that I was encouraged to hear you talk about possibly expanding that. I'm glad to see it restored, but also the idea that we might be able to expand it beyond downtown. There could be a lot of things that we could talk about. Maybe we identify neighborhoods or, and there might be something of which if you do certain things to beautify your facade in those areas or, the front yard, that it may inspire other neighbors to do the same. And maybe we have some sort of program where we can start to turn some of those neighborhoods. So.
Well, thank you for that support. And again, that's the whole idea of trying to look at some of these investments and how they can multiply.
Yeah.
Really provide a much better outcome.
Have you thought it through whether you'd be talking about grants or low interest loans or have you gotten that far?
We haven't got that far of all the details, but as we roll this out in more specifics, we'll be able to present more of that detail to you.
Okay, look forward.
Yep.
Okay, look forward to it. And I will just say that I have 5 years of, in quotes, fond memories from the Board of Adjustment of examples of zoning violations. And I just wrote down unlicensed vehicles, cars parked on the lawn, RVs, trailers, and boats on driveways, fences in places are not allowed, fences that are too high, illegal signage that's either too big, too many signs, no lawn has been established, and illegally poured driveways. Many times it was people didn't get a permit and they paved their whole front yard and they didn't have enough 90% living ground cover in the front, or they didn't get a fence permit and they put a fence in the front yard and it blocks traffic, or they put up a 10-foot fence because they didn't like their neighbor. And we'd get into those arguments, and those got ugly sometimes. So those are just some examples.
I'm happy to say that the number of board cases has really dropped ever since you got off the board, the number of cases has dropped. So, I don't know.
Yeah. Very good.
I'm sorry.
Thank you.
One of the things that we've done historically is that when we see a trend of certain types of variance requests, then maybe we should go back and look at the ordinance, and we've done that on occasion over the years too.
Yeah, absolutely. And I know with Shaped Places, there were some things where people were coming to the board over and over and over asking for certain things. And
Like
so
an increase in fence height in certain
yeah,
locations.
yep. So like Pete, there's more flexibility to do fences and double frontage lots up on the street with Shaped Places because they were being granted so often. The obvious thought was, well, we should make it law so that everybody can get it. And you don't have to come and pay a fee and get it, and the other neighbor doesn't. So that's a good thing. Thanks.
Before I go to Councillor Staley again, anyone else have questions? Councillor Brecky.
Just a couple questions, Mike. When I was campaigning, and again, consider the source, it was at a builders group, but they were really concerned about how long it took to get permits, and they felt like that it took an extra long time to get permits. And I was looking at your documentation, and it didn't look like there was a problem. Can you just tell me, do you perceive that as a problem? Do you have enough plan checkers? Because from that community, and of course that's the community that uses it the most, and they were, they have that building period of time that's limited by our weather. So I just wanted to follow up with a question on that.
And Butch Warrington, who's our Chief Building Services official, is here. I would just say in general, the Home Builders Association primarily is the one that we interact with, and one of the things that we're going to be more proactive on going forward is to have regular interaction with that group and some of their representatives to talk about, are there specific issues or cases where you believe we can improve customer service? Some of the issues that we have dealt with in the past is that we had a significant amount of turnover with our plans examiners due to retirements. And so as we brought in some new employees that maybe didn't have a lot of experience, it might have taken longer to go through those plan reviews. And then there's no doubt that in the spring and in the fall is when we have our peak times. That's when we have the peak times for building plans and permit requests. So there are times that you may have to wait longer than you would like, but we do work hard to try to reach these goals all the time as much as we can. And again, with the online plan review and online inspection requests, that's another way that we can help speed some of that up. But we're always going to have a few that will fall between the cracks that maybe have to wait longer than they would like, depending on the time of the year and depending on the staff that we have at the time. So we recognize that there's always a concern about that, and we are going to be, as I said, more proactive of working with the Home Builders Association to try to address any specific things that a contractor or the organization has.
Thank you. That's kind of what I was hoping to hear, because I think that's really what they were asking, at least what I was hearing. The other question I have is about the platting process. I've been told that our prices for the cost of platting has increased dramatically, and that we have some of the highest platting fees in the area. And so can you just give me a little history on that? Just bring me up to speed on why our platting fees are higher than anybody else's.
Sure. The platting fees were implemented a number of years ago as a result of discussions with the council on our capital program. How do we keep up with the demand for arterial streets? That's kind of where it started. And when we looked at the developers' request around different areas of the city each year for capital investment into roads and infrastructure as part of those roads, how much of our second penny should go to roads, particularly arterial streets, and how much should the developer pay with new construction? So the platting fees went through a lot of vetting with local organizations, with Infrastructure Review Advisory Board, and there's a platting fee for roads, and there's platting fees for utilities. So when you plat a parcel of land for construction purposes, there's a fee that you pay based on what the zoning is or is going to be and the size of that parcel. And so the idea is that we put those platting fees together with our second penny and our other utility revenues to pay for these major arterial road projects to try to basically keep up with the development
Thank you.
requests.
That's very helpful.
Yeah.
Thank you. Counselor Staley.
Okay, now, just let me clarify with what Brecky says here. 2009, we raised the second penny. We were going to do some kind of a match with the plating fees, but as it ended up being, is that that second penny portion far outweighed.
Yeah, we rounded the second penny to a
Right.
full penny, yep.
But it was supposed to be, my understanding, because I led an effort against this back in 2009, but the developers were supposed to, I think it was going to be like a 50-50 thing, and it's turned out to be 80-20 maybe. The plating fees haven't,
So we went through
supported.
this period of called the economic recession,
right,
kind of shortly after we implemented
That's
those.
right.
And now we're starting to see that fund grow a lot more each year. So that goes through Public Works, and maybe what we can do is get you a chart, a Mark Cotter chart that would show how those plating fees revenues have tracked, or maybe finance can do the same thing.
but it wasn't quite what they had anticipated at the time, I
It
think.
started out a lot lower than what we had projected.
So the facade easement, are we still calling it something different now? Or are we still going to call it facade, you call
We're
it the
gonna
core?
call it the facade revitalization.
Okay, that's the same
That's
thing
the
as.
new name we want to give it, yes.
But it was facade easement.
Yep.
So, and I'm glad that Counselor Neitzer brought up this broadening base of availability. How far out from the downtown area are you thinking this is going to go?
We're looking at all of our core neighborhoods around the downtown area that would be,
Well, like Minnesota Avenue?
we're talking about even into the residential areas,
Homes, you mean?
more commercial type uses.
Okay.
Yep.
Yeah,
So
that,
businesses within the Pettigrew Heights, businesses within Whittier would be potential users of this fund.
okay. And then, let me just go back to clarify, Counselor Starr, this isn't really your expertise, Adam Roach, but with these neighborhood get-togethers, the city does not provide plates or food. Am I correct in saying that? That's, anytime I've been involved, the residents bring all of the materials that we're eating, using. Is that Adam, correct? So you're providing the staff,
The city does not provide food or beverage.
or how about plates?
We are allowed to pay for plates.
Really?
Correct.
Forks and plates?
Yep. Paper products.
I didn't know that.
Yep.
Again, that'd be nice to know in that list of things that we're getting for that.
Yep. But that's something that we always request, the neighborhood associations to work with their local grocery stores, their neighborhood assets, and make those requests as well.
And it used to be with Neighborhood Watch that shot, I think it was Target, would give the Neighborhood Watch groups a $100 gift certificate. I think that's been cut back on now. But that was kind of nice, because you'd have that, you could buy supplies for your picnic, and then my understanding was it was kind of back on the residents. So again, let us know what is available for that. We'll pass it on. Thank you.
Any other questions from counselors? I have a couple. Is with the core facade revitalization, I know that we've had kind of a wait list, if you will, for the facade easement. Will that still maintain what was there before, that list will still be in the order? And so if, can someone jump the list? Can someone qualify above somebody else, or how does that work?
We'll continue to review those as they come in, and the ones that maybe have been in the hopper, I don't think you're talking about ones that have already been approved, but maybe some of the future ones.
Right, that's correct.
Yeah, we'll continue to use criteria for those, but we want to expand this program to may include other applications of the funds.
Okay. Well, and then follow up for that is, how will the process be changing for that? Is it just if someone is interested, they will apply, and the application, how different is that process?
We would
going
still
to
have
be?
an application process, and we would have criteria that will explain in that application process.
Right.
So that would continue. The difference is that we're looking at broadening the categories to include other types of revitalization eligible projects.
Okay. An easy question for you. It's year 5 on the council. EnviroGov, I'm probably saying it wrong, EnroGov?
EnerGov.
EnerGov.
Yep.
Is it 100% operational? Or are there still bits and pieces that we're still waiting?
There's still some applications that we're still working on, yes. So it's not 100% there yet.
What is it going to take to get 100%?
Some of this is at the national level.
Okay.
That they're writing some special software programs for us, and that's what we're waiting on in some cases.
In 5 years, technology can really change. So I feel
Yes.
like within 5 years of technology changing, you might need to implement something different because we've been waiting so long to get some of that done.
So it has been a long process, but as I said earlier, we're really pleased with the trend line on the CSS portion of that.
Correct. Thank you. And then I have one other question. With the CVB and that money, we've heard a lot of ups and downs with funds not coming in as projected. They're seeing quite a lag compared to other times. So while we have the same budgeted amount, what if they come in at 3 million? Does the city make up the rest? Or are they kind of needing to balance their own budget? How does that work?
I think they would have to find the gap. They would have to find the gap themselves with other
Strictly a
revenues.
pass-through?
Yes.
Okay.
We're not obligated, if the revenue goes below that line, we're not obligated to fill that gap.
It's just the projection that we have
Yes.
for that time
It's
for
all just
planning
strictly
purposes.
whatever we get in, we send back out.
Okay, one last question, I'm sorry. My other question is in regards to TIF, since that's now under your department. I know that we have talked with having that conversation come in front of the council again, giving us kind of that TIF dashboard. What does it look like? What ones need to be, that have never started, need to be removed? What are the paybacks? Things, just really an all-encompassing conversation in regards to where we are with TIFs that have passed. So my question is, through that and the changes in the legislature, how has that impacted your department as far as providing that information to the state with the TIF dashboard and the information that they need, or has it not yet?
It has not yet, but we're working on putting together this TIF dashboard. We have 12 active TIF districts right now. The discretionary tax abatement, those kind of things that require some reporting, we're putting that together as you have requested. So I think with the transition, what we've discovered is that maybe we weren't reporting some of that in the past as much as we could have or should have. And so what we're working on now is to put together more of a summary for finance for the council each month to give you a report of where we're at with all of these different programs. So it's a lot more transparent than it has been.
Great, that sounds good. There's just, I mean, as you know, we all come with really different backgrounds, and you have to be know a little bit about a lot, and it's frustrating at times that things are flying at you and you're trying to get a good grasp on it, and I don't know about a lot of these different things, and so I'm learning as fast as I can too, and so I thank you for bringing that to us and educating us on some of those unique opportunities and how we can make those policies
But
better.
any future request for tax increment finance will still come through our department and then ultimately to the city council. That will not change.
Correct. Any other, Councilor Neitzer?
Yeah, it just sparked a couple things. The core facade program, how much money do we have in there right now, and how much is unencumbered, I'll call it, which is not spoken for?
For this current year. Is that what you're asking?
Yes, yeah.
All the money that we have is committed to projects.
Oh, it is?
Through agreements that you guys have signed off on.
Okay, all right.
Consent agenda items.
Sure, okay, very good. And I will just say as well, it'd be wonderful to see, like, and I'm assuming this is in it, I guess don't know that I've seen what a TIF dashboard looks like, but to see, what the valuation started at, what the valuation of the property is now, how much, and then, how much was authorized, how much has been paid out, how much is remaining that they can take, how much, what year does it expire? Pretty much all of that would be really neat to see.
And we're getting real close to having that done for you to look at.
Perfect, thanks.
Just didn't have it done for today.
That's okay. That's okay, thank you. Any other questions? Seeing none, we'll move on to affordable housing, and you are up again.
I will just kick this off. Again, emphasizing that affordable housing is part of planning and development services, but because of the unique nature of the different funding components, as well as the variety of programs and the accounting process, we're presenting it as a separate budget for you today. And Les is our affordable housing manager who has presented this to you in the past. And so I'm going to let Les continue on with his legacy and present to you one more time, at least, the affordable housing budget request for 2019. So how's that for an introduction?
That's awesome.
Sounds great.
Hopefully he paid you.
Are we getting too much feedback?
They're better when they're far apart.
Okay,
That way
sorry.
when you move your face, it follows you.
Welcome, Les.
Good afternoon. As Mike said, my name's Les Kinstead. I'm the Affordable Housing Manager for the city, and I'm glad to be here. It's good to see you. I appreciate and respect the time that you folks put in, and so thank you for the chance to speak with you. On the slide that we have up on the screen right now, and I presume up on your laptops as well, or your screens, we basically have boiled down what we do to 4 major areas. We have programs that are subsets within that. Most of those programs are a little bit smaller maybe than what I'll be talking about today. We can answer any questions, but if we focus in on those 4 program areas, one of the objectives that we have is to increase the supply of affordable housing. And we focus in a couple of areas. The first one, our dollar contribution is small, but when you team it up with what we, the work that's done by the South Dakota Housing Authority and their low-income housing tax credit program, this is a major mover of affordable housing in South Dakota. They have tax credits that amount to some roughly $30 million a year that goes into affordable housing tax credit projects and provides equity for those projects. What we've done is we provide local dollars in comparably small amounts. This is a $60,000 budget category, but we provide those, and that allows the local companies and local organizations that are receiving or applying for tax credits to get additional points on the ranking system at the state level so that they can be a little bit more competitive and hopefully make the difference between receiving tax credits or not. So that's a major area that we partner with the state on. The other major area where we work, and we'll go into this maybe in some more detail as we get through my comments today, neighborhood revitalization. You've heard facade revitalization of facades. We've talked about downtown. In the neighborhoods, we're doing a number of things there. The basic motivation of the basic program that we have here is we buy within the core neighborhoods of Sioux Falls. We buy dilapidated and run-down properties. Many of them are far worse than you can imagine, and we buy those properties. Typically, we have scraped those properties. You get it down to bare lots, and with our affordable housing partner, Affordable Housing Solutions, an offshoot of the Housing Commission over on Minnesota Avenue, they will contract with individual private developers to build houses within the communities. So a major provision of affordable housing to people, low and moderate income people. So that's another area where we do a lot of activity in that area. We're now at 20, targeted for 2019 will be 20 homes that we would be trying to do in 1 year. So we've grown that program a lot. There'll be some more comments about that in a minute when we get to the actual budget amounts. We also have an objective to stabilize the supply of safe and affordable housing. When you look around, especially in the core parts of the city, and we also go into other parts of the city out beyond the interstate bowl, is a lot of single-family homes that are owned by low and moderate income people. You'll see this with families, you'll see this with seniors, where they don't have the dollars to keep the property up like it needs to be, or they have bad roofs, they have plumbing issues, electrical issues that don't meet code, and so we provide up to $25,000 in the form of a loan to those homeowners and rehabilitate those properties. And those loans go against the property. Most of the loans are not loans that have payments coming in on them, but when the house is sold, we do recoup that money back again that was put into those communities. The average size of the loan on these is about $10,000 to $11,000, but we can go up to 25. And again, we'll get some more information on that in a few minutes. We also replace furnaces. This coming 2019, we'll be budgeting for 35 furnaces to be installed in low and moderate income families' homes throughout the community. Makes a tremendous difference to people. I always tell the story about the little old lady living on Social Security and literally a very senior citizen. $800 a month in Social Security income, 200 and change, I think it was $230 heat bill, and getting rid of the old octopus style furnace that she had, I think her bill went down to somewhere in the neighborhood of $60 to $70 a month. So on that kind of an income base, makes a tremendous difference for people. So makes a, we also do down payment assistance. That's a program we did a lot at higher levels in previous years. This in 2019, we'll be budgeting for helping with a $5,000 loan, the first-time home buyers. So that's a program. The one thing that's changed that over the years is that back in the early days when we were doing 40, 50, 60 of these a year, there weren't other programs and we funded those. Now, South Dakota Housing Authority that I mentioned earlier has a program for that. Up until recently, there was Grow South Dakota out of the Community Action Agency in northeastern South Dakota that worked all over the state. So that has diminished somewhat the demand for that, but we still have that program. Try to use it in our neighborhood revitalization homes if we can. And then another major initiative that we have centers around homelessness and dealing with families that are homeless. The program is set up and we'll be serving 80 households through that Bright Futures program. The program is set up where families that are homeless can come into the program. The initial shot or the initial help that we can give to them is rental assistance to get them with a roof over their heads. But with that program comes the condition that they need to take classes and coursework that teach them the things that mom and dad didn't teach them. How do you budget? How do you apply for a job? How do you be a good parent? All the kinds of things that you need to know to be successful in life. And it's amazing the amount of people that are able to benefit from that kind of education. So we provide 80 households will be going through that program, and we will have 60 households where we have rental assistance. That money is used if a family has $10,000 in income, they shouldn't be paying more than $3,000 per month for their housing. Divide that by 12. You can see that that amount of money doesn't reach across the board for the housing that people need. So until they get on their feet and start earning, we fill the difference between fair market rent and the fair market rent and the rent that they can afford at 30% of their salary. So those programs, those are the the four major areas where, thank you, Mike, where we serve. The next slide goes into the different categories that finance has developed to apply across the city as a whole in the different categories. You can see it's a pretty straightforward chart. There's only one blip there that I'll be explaining to you here in just a minute. But administration, rehabilitation, all of those are very little variance between them. The one area that jumps out at us is the revitalization budget, the program that I was just talking about. Some of this is the differences in reporting over time. Some of it is the fact that our program doesn't end and that program doesn't end and begin in a given year. In other words, a house can start in April or May or June and not get completed and sold until you're into the next year. So counting numbers of, counting numbers of homes completed in a year can sometimes be a little bit tricky. When you look at the 2018 budget, it was budgeted at $1.9 million. That's sufficient to build and construct 9 homes as we've mentioned before. So, and then, however, in 2018, we did actually 15 homes. So if you start extrapolating those funds, the amount of money that we spent in the houses that were produced in 2018 is actually $3.2 million and 15 houses. In 2019, we're going to be going to 20 houses, and that budget amount will be the 4.5 or 4.4 million that you see there. So the difference has to do with reporting cycles and when you get those funds are available and how the original budget was drafted. In July and August of 2017, we budgeted for the number of homes that you see there, 9 homes. Turned out we were able to do more. So the real number, if you look at 1.9 million, is probably more like 3.3. So it may sound like the fast shuffle, but I'd be glad to answer any questions that you might have on that. The other programs, I think we've talked about the various programs that we have. The budget categories are there, and I don't see a need at this time, unless there are more questions later, to delve into any of those. They're pretty much the same as previously. The funding sources slide, people look at our program and say, boy, that's largely federal money. If you look at it, federal money is a real important part of it. We're talking about $1.5 million in what's called CDBG, Community Development Block Grants, and home money that comes from the feds. However, when you take a look at the real bulk of what we do, it's the return back to the department from the investments that we've made over the years. The loan portfolio that we have within our department is about $21 million. And so when you see the program income coming in, restricted income that still has federal strings on it, almost $1 million in loan payments and interest coming back in. Loan income unrestricted. When we fund and develop the houses that we have in our neighborhood revitalization program, we have a revolving loan fund. That amount of money is $1.6 million, and that will be put out and used to build homes, and the income comes back in again then when that house sells. So it's like construction financing. During the time that you're building those houses, you use that money to carry the debt for building those houses. It goes on the market, it sells, the new owner gets a mortgage, and that money comes back to us. So we can recycle that money through. We're now getting to where we go through about 2 cycles of that fund every year. So a lot of income. General fund contribution, the important part that are actually local tax dollars that you folks appropriate and budget, right at $935,000 is what that amount of money is. Other revenue, $100,000, so coming in at about just under $7.7 million for revenue and where it comes from. So a lot of talking. Best thing to do when you've talked a lot is be quiet and listen for questions. So,
thank you, Les. Councillor Selberg.
Thank you, Madam Chair. Thank you, Les. I always appreciate the job you do. Your knowledge and passion on the subject always shows, so thank you for your efforts. A couple quick questions are, when you do some of this neighborhood revitalization, how far out in the radar do you go? Do you have a plan for 3 to 5 years where you go, we're hoping to get over to this part of town and that part of town, and do you have it kind of mapped out that way, or we're going to get to certain homes in the neighborhood we're in, or I mean?
Well, there has been a fair amount of emphasis over the years on the core for neighborhood revitalization. That's where you're going to see the most homes that are going to be in woeful shape and where you can actually do the revitalization. Within that core area, and that's not to say we wouldn't go outside of it, but so far we haven't done a lot of that. But within that core area, there's discussions going on right now, like for example, Pettigrew. Mike and I just talked this morning about some opportunities there. The people who we work for on up the line to the mayor's office are talking about the kind of things that can be done in neighborhoods to truly revitalize those neighborhoods. So I hope that's an answer to your question without going on forever.
No, I think you hit the point there. The furnace program, you gave that example of how the one individual saved who knows how much money just by getting that new furnace. How many applications, how easy is it to apply for it? How many applied to get the number of 35 who got it?
Yeah, I would have to get back to you unless Al Rutger, you have any feel for the number of I would say, and like what Al said, is that of all the applications that we get, he's saying 50 to 75% of them get approved. I would think that it's all of that. It's not hard to apply. Well, I shouldn't say it's not hard to apply for. There's a lot of information that we have to collect. One of the things that the CDBG and home programs insist upon, and you have to do, is prove that it's for the benefit of low and moderate income people. So what you do is you collect information on the income that a family has, how many people are in the family, bank statements, looking at those statements. Why did you have a deposit here for $1,000? Where did that come from? Is that family income? Is that a loan? So we go through a lot of that kind of documentation. So it's not simple, but well worth the effort and certainly not insurmountable. We have one staff person who probably 3/4 of his time is spent just doing those applications and working with people.
Would you say a number of people aren't getting approved because either the funds ran out for it or they just don't qualify?
I don't think, I would like to get back to you in terms and firm up that number of how many get apply and how many get approved or fall through. My experience, I don't think you're going to see a lot of people falling between the cracks and that, but I think I'd be better off to, instead of estimating what it is, to get back to you directly with what that fallout ratio is, or washout ratio.
Okay.
Or
no, I'd appreciate it. Thank you.
Yeah.
Any other questions for Les? Councilor Starr.
Yes, thank you, Les, for all of your work. I guess with your years of experience in this, because I think those of us in the political world run around and talk about affordable housing and what we're doing, that we're just not there as a community, that, you know, there are needs in a number of places. And if you had that magic wand and I turned the checkbook over to you, which I don't have the power to do, thank goodness, but at some point, where would we start? What would we do better than what we're able to do now with the resources that we have?
The problem is vast and involves so many people, and there are so many dynamics to the economics of wages, the economics of what it costs to construct, so on and so forth, that any one, I think this problem is something that you're going to continue to see over the years. It doesn't mean we can't do something about it. It doesn't mean that there aren't programs that can be used to address that, but it is a very difficult thing to do. The checkbook's got a lot to do with it. If you do the math and say that the waiting list at Sioux Falls Housing, and this is a number that people will debate back and forth, but just for math purposes, take 2,000 households times, at a minimum $150,000 per apartment, and probably something like around 200 for single family homes. Multiply that out, you can see it's a phenomenally large amount of money. So I think you have to take it a bite at a time. You have to look at the programs that are effective and that work. But I really don't think, Councilor Starr, that you're going to see anybody who can solve it. And the only people with the amount of money that it would take to do that are federal government dollars of that kind of magnitude. The other thing is, it's not just a question of bricks and mortar. When people are homeless, and why people are having difficulty is because their incomes are lower than what they need to be to have housing. And that goes into so many things like the Bright Futures program, having people who understand that you have to do certain things in order to be successful and train your kids to do that. And the lessons that people learn in that Bright Futures program is largely just how to live your life and to be a successful contributing person. And there are people that don't know that. They weren't taught.
Well, I think that's I think that's a great answer, and I think that's one of the things that I hear people say all the time. We keep talking about bricks and mortar and doing programs to build more housing, and we need either more apartments or single family or duplexes and fourplexes through the whole thing. And I find it interesting that the first thing you talk about is wages. You know, it really comes down to people being able to afford the housing, then that's where the shortage comes from. Sure. And then that financial training of understanding of being able to take those wages and put them into play in a responsible manner, and learning that some of the simple math and compound interest that my father beats into my head all the time. So sure. Thank you. I appreciate that answer.
Thank you.
Any other questions for Les? Councilor Staley.
The Bright Futures program, how many employees are working to facilitate that?
when it comes to direct caseworkers, there are 2 caseworkers or case managers that handle at any one time 42 families. So there are 2 people doing that. There is 1 lady who is involved in supervising not only that program, but another one called Heartland House. And I don't know the number of counselors involved in Heartland House, but that 1 supervisor handles, I would say probably, I can get you the number, but 5 to 7, 5 to 8 people who are caseworkers.
And those are our employees?
No, they are not.
Well, so when you say, okay, so 80 house, so how are we affiliated with Bright Futures?
Bright Futures is a program that's operated by Interlakes Community Action Agency. ICAP is out of Madison. They serve a 14-county area from Millbank all the way down to Elk Point and west about the 2-county tier up and down the state. And they're called a subrecipient, and we pass dollars through to them to buy those 2 caseworkers, pay for those 2 caseworkers, $150,000.
So we're passing through federal money to them?
Yes.
Or, no, okay. Well, you know, you're talking about giving these people things they didn't get from their parents.
Yep.
I would be supportive of an initiative that would say that if you're getting some kind of subsidized housing in Sioux Falls, you have to take a class like that. Because, Counselor Starr, I do agree wages are part of it, but I think also money management is a big part of it. And we hear stories all the time of people who have risen up from horrible situations, poverty. We had a council candidate who had been living in his car at one time, and yet they made the right decisions to take the resources they had and to make something good happen. So I think education is really important for people. I mean, how would that look if we were to say, if you're getting some kind of subsidized housing, because we have a lot of people, right, in Sioux Falls that are benefiting from apartments that are somehow
yes.
being so if we would have some kind of training.
I can't, I'm sorry, I was
go ahead.
I can't speak to some of the other programs that are going on. This one does have a curriculum. Mm-hmm. There are classes, I think there's 5 or 6 classes that they take, budgeting and how to handle your money, healthy relationships, troubles between partners or things that get people into bad situations, and learning how to recognize what those things are, how to be a good parent, how to raise your kids, and what you have to do to get those kids off to a good start. Those are the generational poverty types of things that we need to address, if as much as you need to address the idea of building affordable housing. So yes, that's part of this program.
There is an entity in our government that has their hands, they're somehow connected to every person getting some subsidized housing, right? Through the city. I mean, any of these apartments that are offering assistance, is that coming through the city? Or are there some apartments that are built that have nothing to do with us?
There are multiple forms of it. There are lots of things that, like low-income housing tax credits through the South Dakota Housing Authority. Those are something we don't have. I mean, the city of Sioux Falls does not have a role to play in that other than encouraging and facilitating and so on.
Well, so I mean, just moving forward, I mean, that's something I'm going to keep throwing out, that we,
sure.
if you're getting something from us that way, we have just a little requirement that you get some training. Like, okay, the second thing, when we're talking about, and we've been through some of these homes, you buy a dilapidated house, you level it off, you're building it up again. So from the cost of the land to the property to getting it ready to sell, what's the average investment that you're making in that?
Looking at this year's budget numbers, it's most of the houses that we're talking about come in at $210,000 by the time you're done with everything.
And what are you selling it for?
You bet.
$210,000.
No, we're not selling it for $210,000. There's about $50,000 of that cost that comes in the form of 2 pots of money. One is the federal home funds that we receive in the grant. That's about $30,000 per unit that we build. And there's about $20,000 of general funds that go into that. You can't build affordable housing without that, for lack of a better term, subsidy. You can't fill that gap any other way because it costs more to build
and you can't carry that as a low-income
So
person.
what's the cost? What are you selling it for?
160, 169.
Okay, so I'm thinking to myself, gee, I wonder what Habitat for Humanity pays when they would build a new house. What does it cost Habitat to do a new house?
I
Any idea?
haven't specifically talked with Habitat, but I know that part of what happens with Habitat is that an awful lot of it is volunteer labor.
I know.
So it'd be
Yep.
difficult, I mean, not difficult, it could be done, but we could certainly get comparisons and try to
Well,
chase that down.
because I mean, that's a big, and for 210,000, I mean, let's just say that, I mean, we're going to be listening tonight to some people talking about rehabbing homes. I mean, I would wonder what you could do with a house for 210,000, an existing house. We're talking, because we're after the same goal here, but have we ever looked at partnering with Habitat and using that energy to bring the cost down, bring in more community involvement, and make this a better product?
We're always open to what partnerships could come about. We're always willing to work with people and other organizations. We already support Habitat in one way. Part of the budget that you see here this year, in 2019, we'll buy 3 lots for Habitat to build houses on. So I guess beyond that, I'd have to give some consideration to what you're saying and try to give a better response than what I probably can
Yeah,
give on the
because
fly here.
we're talking about a $40,000 discrepancy between what we're putting into that and what we're selling it for. And so for $40,000, I mean, I think you could even maybe buy a little workforce or something. I'm just saying, looking at options to make it more cost effective and still get the same.
The thing that you want to remember too, just by way of comparison, first house I bought in Sioux Falls, $16,000. The next one I bought, $53,000. Right now, a new starter home, or even buying something in the community, as a realtor can tell you, average price about $190,000. It's expensive. The starter homes that you see being built by Nielsen and some of the folks that build those starter homes, I looked the other day on the website, it's $239,000 was the lowest one I could find. So it's expensive, and getting the older ones can cause rehab
You're right,
issues so
and my concern is so expensive. If people are getting loans, they're getting into these homes and taking that loan, and then if something would happen to drop with the market, these people are going to be upside down on houses big time. Okay, so then the last thing is that, and I'll put this on Facebook too, because I think it's a great program. It's community development, used to be called. And I think you're calling it rehab of single-family homes, right? Where they can
Our department is affordable housing. One of the programs is what we call single-family rehab.
Right, and you said generally the loans for those are 10,000.
The loans can go up to 25. The average cost, when you look at the amount of money that went into it and the number of homes that were rehabbed, it's around $10,000.
10,000. That's a wonderful program. And the furnace program, Ms. Selberg asked about that. I would say it'd be wonderful if we could offer 100% to people who were had the right qualifications to get that. But those are really nice things we do to help our community.
If the person qualifies, we go up to $3,000 on a furnace, and generally speaking, that catches the furnace. So,
okay, thank you.
Yep, you bet. Thank you for your questions.
Any other questions for Sam? Sorry, go ahead, Councilor
Yes.
Sale, sorry.
I have one. Les, I'd just like to say, home ownership is what really builds a community over time. And I know there's federal money, there's state money, there's city money, there's nonprofits going into this. How do you coordinate all of the programs that are going on there, especially with the nonprofits doing their thing? Do you step on other people's toes? Are there gaps there that we're not getting? I'd like you to comment on that.
Yes, yes, and yes. Coordinating it is like a multi-headed hydra. There are toes that get stepped on. There's competition. There's all the kinds of things that happen, and it's a difficult process. This Thrive study done by Augustana Research Institute for the Thrive Project basically said we're program rich and systems poor. We've got lots and lots and lots of programs. All we do as a people, and is, oh boy, I've got to help kids with this, or I've got to help someone with this, and before you know it, you've got lots of them. So it's a major issue. Coordination and pulling together of the system is a very, very tall order. Councilor Selberg and Mike and some other folks have been working with us trying to start to address some of those issues, but it's a big one, very sensitive one.
Thank you.
Councilor Brecky. Welcome.
Just a question about the, you build around 20
houses.
Just a question about 20 houses a year. How do you develop those sites? I mean, how do you know which sites, how do they become available to you? How do you access them? We're going to be discussing a situation tonight, in the All Saints district, where we're going to have the potential of losing, 3 what could be lovely homes in that neighborhood. And I'm just looking at them, and as I did a walkthrough, and I was, around that neighborhood, and I was just wondering, do as a council member, would I just recommend that to you or something, or would you, how do you find out about what might be available where you would actually approach people and make them an offer?
We have one staff member who operates this program on a day in and day out basis. He is part of the code enforcement neighborhood services folks here that are in the same department as we are. They meet, if they know there's properties that are dog-eared and bad and in code violations, we will start investigating, talking to people that own those homes and say, I could help you with this, we would be interested in your home. So that's one way that we get them. Referrals, if you know of something that you think might be helpful, that, would gladly take any referrals that you'd want to send. So there are lots of ways the word gets out on the street. Realtors will know of the fact that we buy older, dilapidated, really bad homes. I mean, the ones that we've bought, we typically don't spend over $30,000 to acquire a house. And usually when they get to that point, they are so difficult that rehabbing them is they're beyond that. So
you're working with your code enforcement. That would be a good way to know
Yep.
what's really fallen down into
Yep.
disrepair. Are you familiar with the ones on 18th in Dakota, the 3 houses there? As I know, Matt's been working on those. The code enforcement guy.
I'm familiar with that. I've watched over the years that lot develop and the stuff encroaching or moving from Minnesota Avenue over. So yeah, if I've got my bearings straight, I think I know the corner that you're talking about. And have we watched it? Yes, but the ground underneath it is owned by a private party and will be developed as a commercial real estate venture. So with us, number one, it would be pretty expensive to put houses on, but we're open to finding stuff anywhere we can, and if it works monetarily, we'd gladly do what we can to try and develop it.
Thank you.
Councilor Selberg.
Thanks. One other question. I should know this, but I'm forgetting. Could private sector funding ever be injected or accepted or partnered with by the city? Like, let's say Jenny Sanford, Bill Gates, whoever decides they want to donate $1 million to this furnace program. Is this something we want to donate $1 million or whatever to the affordable housing effort? Is that something that could ever tie into this, or does it always have to be separate? Or
we've had conversations with developers in the community that build single-family homes and looking at ways to do things. That's since my time here, we've had that happen several times. So yes, I think there are ways to get public-private partnerships to do it. In fact, I suspect if we're ever going to make a really significant dent in this, that's what you're going to have to do. And it's going to cost a lot of money.
Yeah, that's kind of what I thought too. I just wondered what the possibilities were. So
yeah, no, I think and those are being discussed, and as the opportunities unfold, I think it makes sense for the city of Sioux Falls and you and the mayor to be looking at those kind of things.
Sure. Thank you.
Thank you. All right. Thank you, Les.
Thank you.
Next up, Transit, Director Mike Cooper, and I see Sam and crew here.
So our last budget presentation tonight, Sam Trebelcock, who is our expert on transit, is going to go through our request for 2019. Sam?
Welcome, Sam.
Thanks, Mike. Sam Trebelcock, Transportation Planner, City of Sioux Falls. With me today, you'll see that there's 4 people in the audience here from Surrey Metro administrative staff. We have Randy Hartman, General Manager, Robert Speaks, Assistant General Manager, Glenn Wright, the Operations Manager, and then Tirza Lanham, the Paratransit Manager. So they'll be helping Mike and I with any questions you guys may have as we go along. Now you might remember this, this slide from last year. I think it was important to show to begin with. The situation is still the same. I think that's important to note. There is a lot of things going against transit right now in Sioux Falls, and really, I have to say that's probably the case around the country. There's a lot of things that make it difficult. Ridership is down around the country. It isn't just down here, as we'll go through a little bit. But federal funds are questionable, or certainly are down. We don't have a lot of state funding. Agencies can or won't contribute significantly to some of the human service trips, the day trips. Fare revenues are decreasing. Costs continue to increase, of course, like they always do. Paratransit savings that we have are less than needed. Certainly the city can't go it alone. It's something that we need to look for partnerships from a number of different places. And then fixed routes are stagnant, ridership is declining, and we are going to talk about more on that in a little bit more detail. The first place we start with our budgeting process, and you know, I got to say we work a lot with our finance staff on this. They're very helpful, and we spend a lot of time up front and looking at our transit fund and looking out, in this case, all the way out to the year 2029. We think it's really important, especially in this particular case when our transit fund is, we don't know where the money's coming from, federal funds are down, ridership is declining, those kind of things, and we know our fees are down. So where are we headed? And how do we need to address it is really important when we start looking at what our budget is going to be even for this year. The thing that you'll notice with the transit fund, we do some scenario planning. So we really look at what is now the status quo, what we're doing right now. If we just kept doing things that the way they are now, the service levels, the way we do funding, this is what we'd project in blue, as you see on here. That's not something that's acceptable. I'm sure it's not acceptable to you, it's not acceptable to us. So we wanted to start looking at scenarios that might become more acceptable. If we did something increasing some city funding, in this case it's going from 3 to 4% increases in city funding, which over time is a fairly significant amount of money. That can help us out. If we did something with agency rates, which would be a rate on day trip rates on paratransit for just some of the trips on the agencies, and working with some of the state of South Dakota, as we've talked about, that certainly would help. Also, a service reduction would certainly help too. I don't know that you will see me being crazy about that because we're a growing community. We think there's a vital need for transit, not at a reduced level. In this particular case, we modeled taking away night service. That would certainly help too. As we get further along into the transit fund, you can even see out to 2026, we might need to do more than just one option. So that's important, I think, to note as where we're headed. A lot of this, again, what we've tried to put on this particular transit fund forecast, you can see we added when we're buying buses and how many. And that's the big thing here. That's what's really making the ups and downs in our transit fund. We're trying to build it up, and then we have to buy it down a little bit to buy these buses. And that's what's really dragging down our transit fund. As you might know, and you've heard me say this many times, much of the federal funding that we received for the buses was cut a number of years ago. Sources of fund for 2019, the general fund will have 60% funding, 8% from the sales tax fund, so really well over 2/3 of our funding is local. The other third is coming from state and federal grants, mainly federal grants. In terms of our use of funds, SAM operating expenses, we would look at about $8.7 million. Other operating expenses, which is $500,000, most of that is in our partnership with Dakota Abilities and Lifescape in moving rides to community coordinated transportation services. So that's what that is. The building repairs is something we're trying to look at and build towards to leverage for a grant to help with some of our offices. We're actually doing some design work, hopefully yet this year, to figure out what that cost would be. But we think we can leverage, you know, somewhere close to somewhere over $1 million to help with that. Capital is $800,000. And so total use of funds is $10.2 million. Now, out of that, $800,000 comes from fare and advertising from Sioux Area Metro, and so funding from the transit fund would be $9.4 million. The capital budget that I mentioned, $800,000, is 6 paratransit buses next year that we're replacing. And the interesting thing in the good was that we're looking to purchase 3 smaller buses. We've always had these really large buses, and people ask us, why do you need those really large buses? It's because of those day program trips. They all come at our peaks, and we fill up those buses. Now that we're down a little bit on those, and we're moving it to CCTS with Dakota Abilities and Lifescape, we think we can buy some smaller buses, become a little more flexible, not have so many rides with 1 or 2 rides on a big bus. As I mentioned, our transit ridership is down. Fixed route is something we don't plan for, we don't look to do. Paratransit, we have been planning for that. And that's in large part, we're moving rides, those day program trips to CCTS, as you're seeing here. 20,000 in 2017, we project this year to be about 27,000 trips. So again, we'd move probably well under 100,000 on paratransit rides this year. Now, paratransit, as I mentioned, ridership is down greatly. But the expenses are only down modestly. And I think that's important for you to understand. Since 2012, paratransit ridership is down 30%. Agency day rides are down 45%. Our driver staff is down 35 to 27. But we're only saving about $122,000 in the paratransit budget, which is still a good thing. And we plan to continue shifting another 30,000 additional rides to CCTS by 2021. But even then, we're projecting only 169,000 in net savings. And you're saying, well, what gives? What's the deal? Well, again, that $500,000 that I showed you in the budget that's going to other operating, that's going to Dakota Abilities and Lifescape to fill the gap for those rides. So we're filling and basically paying for the rides on CCTS. We're doing some other things with some federal grants that help us with some savings, and the costs are a little bit less on CCTS, but we're not getting the great savings that we really do need. And as I've mentioned many times, these day program trip rides, the only cost of these day programs that is not funded by the state of South Dakota and the agencies is transportation. And so that's the thing that we're really looking for, trying to work with the state and the agencies, is if we, in the agency rate scenario that I showed earlier, if we got $7 agency rate, we could save $750,000. Now we're talking some good savings. Now there's some things that we can do to sustainability. And that's why we talked about, and thank you for looking at adding a policy to support full state funding for human service transportation, agency transportation costs to help offset that. So we hope to continue working with the state on that. Now, fixed route ridership trends since 2012, it's down 230,000 trips, which is a big eye-opening amount. 46% of that is due to school tripper and trolley services. Most of that's a school tripper services. So those are service cuts. Still about 123,000 is down though. As I mentioned, we're down around the country. A lot of that's because car ownership is up. But is that all of it? And those are the things that we really need to look at. When just looking at some of our routes, Route 1 is down 145%. Some of that's because one of the main destination, Lutheran Social Services, moved off that route, but not all of it. Route 3 is down 35,000 riders, down 11% this year. That's the mall route from downtown to the mall. What's going on there? Those are things that we need to look at. Now, some of it's because we did switch some of our route to Route 10 for Route 3, but I don't think that's all of it. Route 4 is down 15,000 rides. What's with that? Those are things we need to look at. Now, some people have started to ask, well, do we do it differently? Maybe we need to take the bus straight to people's homes and do it that way. Well, that's what paratransit does. And if you see passengers per revenue hour is down on fixed route 2, but on paratransit per hour, you can see the differential. We still think fixed route's the way to do things. When you get 12.9 rides per hour versus 2.3 on paratransit, I think that's a big difference. So do we want to cut evening services or some comparable route service? What we would suggest is that fixed route needs to adapt and improve. And these are things that we need to start to look at. We need to look at technology. Something we're probably behind on transit, and it's things that we're looking at even right now, is could we do, and we have some money, you have some money budgeted in our budget for real-time GPS. So looking at, if you wanted to look at on your phone, where the bus is, a lot of people want to know, is it coming? Just like Lyft. Is my Lyft coming? Well, where's my Sioux Area Metro coming? And that's something that a lot of systems are going to. We'd also like to look at automatic counters as part of that system. And we think we can do that as part of that budget. That would count everybody getting on and off the bus at every point. We don't know that unless we put somebody on the bus now. And that's a really old-fashioned way of doing it and doesn't work very well. Should we do onboard Wi-Fi? Would that help? How about mobile ticketing? Again, you could buy your ticket right on your phone. Places are starting to do that. Something we're going to do right offhand this fall is do an onboard survey. We have a consultant coming in to do, where are people using transit from their employment and their home? What technology improvements would they think is important to them? What are their transit service ratings? It's something we do every 5 years, but we're moving it up a little bit and we're increasing the breadth of the scope of the survey a little bit to try to find these things out. Then next year we're going to do an employer and resident survey that we do every 5 years, and we think that's important to find out from employers and residents about transit in part. Many other things though with that survey. We're not giving up on the transit development plan. We did talk about improvements to transit, where we can go to improve transit, to increase frequency, to increase the efficiency. We think that's still very helpful in this growing community. What other transit service delivery methods are there? We want to look at those things. What about deviated fixed route? You say, well, what's that? They do it in St. Joseph, Missouri. The fixed route bus deviates instead of actually putting paratransit out there. Can we do that on all routes, some routes? How about first mile, last mile? A lot of people have talked to us that they can't get to that outside the 3/4 mile area, that area that we don't serve, but they still want service. What can we do there? Can we work with private firms on a voucher system? I think those are things that are reasonable to discuss. So in just summary, how can we make transit sustainable? We know status quo isn't the long-term option. We need to look at some of these options 1, 2, and 3, and look at some of the other options to consider, including technology improvements, new transit service options, and really, as we talked about it with affordable housing, how can you look at business and community partnerships to help provide services for employers as we continue. So with that, I would take any questions you have.
Thank you, Sam. Questions for Sam? Councilor Neitzer.
Once again, a very important topic, but very stark numbers. So can you tell me what % of the general fund transit would take today if I was to look at the operating fund? Just.
Yeah, I'm turning to my.
Because we see that graph then, like today versus, and if we do the do nothing where it shows it kind of going into the negative, how much of the general fund would be consumed by transit?
You know, and as they're talking about it here a little bit, I mean, we're still increasing pretty much the same with every other department, showing the need first, of course. If there's a need increasing, last year it got a small increase, like a lot of departments get. This year it's getting like a 3% increase. So it stays on level as other departments do. But in terms of the overall budget, it's pretty small.
Okay, because what I'm trying to get a handle on is, I mean, there's a capital piece, but you know, if the trajectory was, let's say, transit uses 5% of the operating account today, if we did nothing, would it end up consuming 20% or something? You know, and then
yes,
other things would get crowded out. You know,
we could certainly get back to you on that amount.
Yeah, that's what I'm trying to get a bit of a feel for.
Yep.
Have you looked at? It's interesting, I heard the mayor talking on the Patrick Lally show yesterday, and they were talking about this particular subject, and I think Patrick maybe had brought this up. Have you looked to see if there's actually any way in which rideshare can be harnessed in some way? Like because I will tell you, just by my count, we have several hundred drivers in town. You know, whether there's, I don't know exactly how it would work, but whether there could be some sort of a synergy there, you know, for some certain rides.
Yeah, I think what we have to ask with like rideshare or any kind of other type system, you know, right now the options there, the issue is the affordability. And a lot of people would say, hey, I can't afford that. So that's where they're looking to Sioux Area Metro and others. So do you want to start looking at, that's where you start saying you could do a voucher system where you could start paying for a portion of that ride. The challenge is how you track those rides to make sure that they're being done, and those kind of things. But other communities do it, whether it's through a taxi company or TDNs or, you know, Lyfts and Ubers. So.
Well, I guess what I'm getting at is, so like if you were to take, just thinking outside of the box, if I took, you know, the entire budget for Sioux Area Metro, divided it by the number of riders, you know, what, I don't know what it would come out to, you know, like, and if it might cost, what I'd say, $7 for a ride and Lyft or something, and then we were to subsidize it somehow so the rider never paid more than $2 or $3 or something, you know, would it be less than what we're paying now? Would it be far more? Would it be break even? I mean, you know, just
I think it's going to be tough, and I'm going to go back to this slide here, and this is why I was showing the passengers per revenue hour. Most of the time when they talk about on a demand basis, you're going to get about 2.5 at the best to 3 passengers per revenue hour. So that's what's tough to make up. So I don't know what it would be, but based upon that, it would be really difficult to find a way that you could cover all those same citizens, the 850,000 people that we service with the same, you know, system that you're talking about, and only doing it at about 2.5 persons per hour. So I would guess it would cost you quite a bit more.
Okay, and yeah, I think anything you can do where you can get a pulse on why people are using it or not using it anymore, and that might be really difficult. I could see that a lot may not be connected, or you know, it's not like you're necessarily collecting, you know, names and contact information, but if there's any way in which we can really try to find out, why are you not riding anymore? You know, I think some of those numbers are really interesting. I mean, some of them you explained, but some of it you kind of wonder where they went. I mean, I kind of know, I kind of have a good handle on why people don't ride it maybe in the first place, but why would people stop riding it?
And I think some of it is, and I'm venturing to guess, and you're right, we need to look at more of the numbers, but the community's changing. It's growing. You got different employment centers in different areas. You don't have it in the same place where they're more diverse. And so people's trips needs are different. So that's why it's important for us to look at where they're needing to go.
Okay, well, that's it's something that I'm glad to hear the mayor said he wants to make an impact in this, because this is something that we keep talking as a problem, but it's really, really hard to figure out what to do. Hopefully we can come up with something. So I hope we all work really hard on that. Thanks.
Any other questions? Councillor Staley?
Well, in response to, adding to what Councillor Neitzer just said, if we're going to be growing to our population $120,000, or excuse me, 120,000 people in the next 20 years, as Mark Cotter stated, this service is going to be needed more than ever. And I mean, with all the affordable housing we're doing I'm hearing people say they can't get to the buses on some of these parts of town. So I'm all for funding this any way we need to. I think it's something, we're never going to break even on it properly, but I think we need to have this. One of the things that we had a meeting with Councilor Starr and I, we met with you guys before the election, and we were talking about the nuts and bolts of this. And one of the things I said is, I think we need a fresh perspective on marketing. And I always herald back to this. Our former mayor, Mike Huther, love him or not love him, he was a master marketer. And let's take what he did for that event center vote. I mean, that man said it, he said it again. And we had a huge turnout for that vote because he understood you need to continue to tell people what's there for them. Same thing with this. I'd support putting some more money into maybe even some radio or TV ads to say, ride the bus. Why should we ride the bus? And encouraging people that it's really a neat thing to do. But I like your idea of, maybe looking at smaller venues, smaller vehicles, voucher system, if that helps. I did ask the same question, why are these traditional ridership numbers going down? And you were giving us, Sam, the routes that lost ridership, did some of them maintain or increase in ridership?
Yes, some of them did increase. I'll give you an example, like Route 19, which goes up to the Walmart University Center area,
okay,
which is kind of a new route for us.
Yes.
That's showing some growth. There's other routes that are showing a little bit of growth.
Well, and you said Lutheran Social Services moved.
Yeah.
And so did that route where they moved to pick up?
I don't remember now.
Yeah, I mean,
Route 7, and Route 7 probably has increased a little bit or stayed on par, so, yeah.
Oh, and then, what is it called, River City?
Yeah, that's the CCTS, River City, yep.
They're helping, so that's getting better.
Yep.
Right, yeah, and I keep telling him, I keep saying, I'll go to Pier with you with a stick, and we'll say, hey, we want that funding that I guess we're supposed to be getting. I'm still not understanding why we're not getting the money that other communities get.
Yeah.
Right? Right. We don't get it, but they do it.
Well, it's varied in all the different levels. I mean, you'll get some places that say that they are getting it to some extent, some that are getting a little bit of it, some probably a lot like us that don't. So but I know in South Dakota it's the same.
Well, and another thing I would say that I think would be really cool is, and maybe you've done this, but have you taken trips to these communities? Have you called a community that has a really vibrant, successful bus service here in the Midwest and visited them, or on the phone or in person? And can you tell me where those communities might be?
Well, I think the different communities, depending on their different situations. I mean, you'll go someplace like Fargo, North Dakota, they have higher ridership than we do, but they have a good partnership with the college. And that's a big difference.
It's a need that they have there.
Yeah, and that's very
helpful. How about Sioux City?
Sioux City, I think they do pretty well. You look at some of where some of their employment is. They've got big employers, and the need for transit fits in with that. I don't think their ridership is as high as ours, but their community is smaller.
So do we have a lot of people taking buses to Smithfield to work?
Not as many as you'd hope, right? Some of that's because they have some shifts that start so early. And then you thought as well, then just run that route early, but it doesn't exactly work that way because we'd have to run almost all the routes early.
To pick up
because of
the people where they
transfers.
live in different places.
Yeah.
Yeah, so I think, but we need to keep looking at what the need is, but I think we're all probably committed to keeping it reasonably priced. And I mean, I don't, what is your solution in 2 words or less?
No, I'm money.
Adapt and improve.
Adapt, I like it. And then what are you paying for the consultant?
Good answer.
The contract that we have this fall was just like 27,000, I think. It was very small. Yeah, yeah.
Thank
It really
you.
was being kind of done in conjunction and part of, but we're doing it separately this year. Typically, it's done as part of the long-range transportation research study, but we're pulling it out because we think we really need to do this sooner rather than later.
Thank you.
Yeah.
Any other questions from the council? Councilor Kiley.
Sam, I noticed that, I'm looking on page 92 of our budget book, and you've mentioned in your presentation here this afternoon that we've budgeted for 6 paratransit buses. In 2020, 6 fixed route buses for $2.86 million. 2021, 6 buses for $600,000. And then in 2022, 5 buses for about a little over 2.5. What are we purchasing in 2021 for $600,000? Is that a misprint, or are we purchasing smaller route buses?
Oh, yeah, thank you. So one thing that we've been looking at is we're trying to find any way we can save money. So some of the buses in the fleet, we're going to send them out and rehab them. So we think we can do that, and it won't last 12 more years or whatever we can get out of a bus typically. But we think we can last another 5-6 years. So we think
So we're investing in the best of the fleet, really, what's in better condition than others.
Yeah.
Having done that, I mean, what else are we going to have to do beyond 2022? Because I think we have, what, 27?
Yeah, you could see what the buses are even going out.
Right.
And we put them right here in the forecast. 2022, 5 fixed route buses. 2024, 7 paratransit buses. 2026, 5 fixed route, 8 paratransit buses. Why it's coming down so quickly is because, you know, we're kind of getting to that bus glut. I mean, we had a lot of buses that we were at some point, and we're trying to hold them off as long as we can and spread them out. But at some point, you know, we have to replace them, or we're going to have a lot of buses in the shop and replacing engines and that kind of stuff. So.
And typically, and another question, of the riders, what percent generally are doing transfers to get to their location, ultimate location?
You know, I think that's something, you know, as I was even talking about this, we want to find from the onboard survey, because I don't think that we know that transfer right offhand. I mean, really a transfer is just another ride as far as our fare box goes. So that's something we want to get a better handle on, absolutely right. And we think we can do more of that with technology to start following that person. And you could do that, maybe there's options where, you know, when you're doing mobile ticketing, where you could follow that person from stop with automatic counters and everything. So we need to get smarter.
Okay, thank you.
Yep.
Councilor Neitzer.
One other follow-up that I just want to make sure I'm clear about is that, you know, when you did the grand opening of the new bus terminal after the remodel and you had free rides all day, I spent all day riding it and purposely made appointments kind of around town and talking to a lot of the people that rode it. What really hit home was this wasn't a convenience, this was their lifeline. It was the only way they're getting to jobs and getting to medical appointments. And what really hit me was kind of coming to, I guess, being okay with the fact that this is a vital service, just like many other services that we provide in the city. And so I'm okay with never making money on it per se. I mean, we're not going to make money on parks. That's not the point. It's just a matter of trying to just keep that subsidy to something reasonable so it doesn't consume the entire budget. But I mean, I would always challenge us to try to figure out what we can do to make it better and figure out how to get more ridership and expand routes. But I'm okay with having a reasonable, but if we don't want to see a trajectory. That's where I was getting at my question, that I don't want to find out that if we don't make any major change, we're suddenly going to be consuming 40% of the operating budget, and suddenly we can't fund parks and things like that. But if we stay at a certain level into perpetuity, that's just part of providing a service to citizens, I think. And I think that's an admirable thing. So I just want to share that.
Any other questions? Councilor Staley?
We didn't hear a lot about the kids ride free thing. How did that go?
That's something I think we can provide results of the ridership. Looking over at staff, do we know?
Well, it'd be interesting to know if it.
We don't have the numbers, but we
do you
could
think just to get a sense that it was still as utilized as it has been in the past? See, and that, again, thank you for those comments, Councilor Neisert, and again, providing that to help our kids get places, jobs, swimming, whatever it is in the summer, I think that's really a wonderful thing.
We can provide you an update on that.
Okay, that'd be great.
Any other questions? I have a couple. My question, thank you for asking that. I was curious about the Freedom Pass as well, and some statistics on that compared to the last couple of years that it's been in existence. Because I know that you've made some modifications to that program, just how you've worked with the school districts, et cetera, with that. So my question is in regards to the tab that says, the line item that says fares and advertising, $0.8 million. My question is, talk a little bit about the advertising. Is this something that can be, that we can bump up by marketing more? Can you do wraps on the benches? Can you do more advertising on the buses? Can you do more, can you sell more, I should say, not do more, sell more on the overhead, the overhead area? Can you wrap those? How does that look? Does everyone pay? That does advertise? What if other governmental entities advertise? Do they have to pay? Do they get the same rates?
Yeah. So we don't wrap all of our buses. Some of that has been a policy to ensure that there's some sense of Surrey Metro buses. That what the look is, what we're about. That there's an identity still with Surrey Metro. So we could wrap more. Advertising gets us somewhere around, you guys tell me if I'm wrong, about 150,000 about a year. And that includes also the benches that you see out there might not be the prettiest benches, but they're advertising the benches that are there. We don't have advertising on the ones that are in the shelters, but the benches just the freestanding benches, and that pretty much pays for maybe a little bit more than the maintenance for the benches. So we don't have to maintain the benches. We don't have to locate them. They decide how to do that based on demand.
Who's they?
An advertising company that we have out of North Dakota that does that. So could we do more? Probably could do more. You could probably wrap more. You could find some other opportunities. I would agree. We could certainly look at that.
Well, and when I say wrap, I don't mean necessarily the buses, but wrapping those shelters or doing some sort of advertisement on those. Because when you look at the buses too, on each, the back has something, and then there's a sign on each side that has something as well. I don't want to throw a name of a business out, but I see one all the time, and I want to go eat there because it looks so good as I'm following them. So I see it happen quite a bit. Do we advertise for ourselves or other governmental agencies, and do they pay the same rate?
I don't know if there's a whole lot of opportunities for governmental. There's maybe a few. So I don't know that there's.
Do you want to step up to the microphone? I'm sorry. Thank you. Just so we can, unless Sam wants to repeat what you're saying.
I'm sorry.
That's okay.
Randy Hartman, the general manager for Surrey Metro. As far as the advertising inside the buses, I just recently, since I took the position as general manager, I have allowed nonprofit agencies to be advertised at the buses for free. like Siouxland Libraries, Bethany, those that are assisting other families, I allow them to post an 8x11 poster in the buses for free. Otherwise, other nonprofits, advertising inside the buses, we really haven't charged anything. We don't advertise a lot inside the buses. The shelters, I don't believe we're allowed to advertise on the shelters because we used to have artwork and the city had told us we had to take that down. So we haven't been able to advertise on the shelters. And the benches, we do have a contract with Creative Outdoor Advertising out of Fargo-Moorhead, and it's their benches that they pay us. And I just, talking to Robert, including the buses being wrapped, we're about $14,000 a month that we get through the advertising. And I hate to wrap too many buses because then we lose our identity too if we do that. So, thank you.
I'm just trying to find ways that we can generate more income if we can. And we hear so many times about sponsorship. So if there's an area that we can utilize that more, then maybe, I don't know. Thank you for your time, everyone. Councilor Staley.
One more thing. We talked about this last year, Sam. How many bus benches do not have shelters, have something over the top?
How many, say that again? How many
Okay, those bus stops, some of them have nothing over the top.
Of the stops, yeah, I could, that's something we could look at.
We talked about that before.
Most of the stops don't have shelters, yeah.
To me, that would, I mean, I don't know if you could find just some kind of way of covering. Think about somebody waiting for the bus. Yeah. It's snowing, it's raining on them. They're sitting there waiting. Yep. They have they have to be there. That would be the basic thing we could do for $100,000 extra that we have to play around with.
Yeah, one thing that we have to look at over the next several years is probably updating our shelters, and maybe it's something that we start looking at something a little different that would provide some more. But the hardest thing with shelters is finding a location for them. Some places there's not any room for a shelter.
You mean by that place where they're sitting?
Yeah,
I'm just, usually, isn't there a bench?
For it. Sometimes it might be right there on the sidewalk where you can't just put a shelter on the sidewalk. That's going to impede travel. Sometimes you have to put it off the sidewalk. Well, then you have to get an easement from somebody who's got to agree to it, or, yeah.
Well, I think we should work at that.
Yep.
And I don't think, Sam, correct me if I'm wrong, but I don't think every bus stop has a bench either, correct?
No.
Yeah.
That's correct.
There's a lot that are just the sign and that's it. Some have a bench and a canopy.
Yeah. And we try to look for the ones that when we get requests, we look at them, we look at boardings to find out which ones would be most needed.
Yeah, the high use areas, I believe, you see a lot of them on Minnesota, Western, 41st, some of those higher traffic areas that are used, the frequently used routes, I guess I would say. One last question I have we switched our paratransit over to a dispatch system yet or no?
Well, it's always been in a dispatch system. What you might mean is we've had a lot of subscription rides where there's a lot of rides that are every day. But Tiers' staff, they have dispatchers, and it'll come in every day. Requests will come in, and they have to fulfill that request within an hour of either side of their request.
Gotcha. Yes. Thank you.
Yep.
Any other questions? Seeing none, we will ask for any public comment. If there's any public comment at this time for any of the items that were on the agenda, please come forward. Seeing none, we will adjourn. We will see you at 7 p.m. Thank you.
Yes, please, where?
I don't care.
Yes, please shut my mic.